blue is work session.
Yeah.
Good afternoon, everybody. Welcome to the fourth work session of the FY 2025 budget cycle. And I'm Board Chair Libby Garvey, and here we've got everybody, Vice Chair Takis Karantonis, members Matt DeFranti, Susan Cunningham, and Maureen Coffey. And today we are starting, I think, with Human Services, and we have more representatives coming from advisory committees and groups. We got a lot of presentations. We're going to try to keep moving. I left my little hourglasses back in the office. I'm sorry, colleagues. I meant to bring that out just to remind us, but hopefully we'll keep things moving. But there's a lot of really important work to cover here. So for those that are watching, I'm supposed to remind you there is a video of these work sessions, and it's on our county website. Oh, thank you. I've got green in honor of St. Patrick's Day. Love it. All right. Mr. Manager, over to you to get us started.
Yes, I'm going to turn it over to the esteemed Anita Friedman. Happy Pi Day, Anita.
It is Pi Day, yes.
Yes, it's Pi Day. We should all have some pie. Okay, good afternoon, members of the County Board, Mr. County Manager, Deputy County Manager Cowan, my colleagues. Today I'm presenting to you the fiscal year 25 proposed budget for the Department of Human Services. I would like to take a moment to recognize my extraordinary team. I'll just try and point them out as they're here. Corey Travis, who's our Finance and Management Budget Director, Brooke Hammond-Perez, Economic Independence Division Director, Wendy Crawford, of course, you know, CSB Exec, Tabitha Kelly, Child and Family Services Division Director, Maimuna Ba-Duckenfield, Aging and Disability Services Director, Carol Layer, Behavioral Health Care Division Director. Back there is Ruben Varghese. Dr. Varghese is the head of Public Health. We have a couple of admin officers, Ann Moser and Jim Baker, Kurt Larrick, our Communications Director, and Ollie Russell, our Deputy for Behavioral Health. And of course, Deborah Warren.
Thank you. And here I thought we had a huge number of public, and then we know all these people. It's wonderful to have you
They're
all
all
here.
here under my request in case something comes up. Anyway, let's start with the DHS overview. And as you probably know, DHS provides human services to approximately 50,000 residents through over 100 programs that go from prenatal to end of life. We operate through 5 customer-facing divisions and 2 support divisions. Our households largely have low incomes or face challenges such as unemployment, housing, insecurity, food insecurity, lack of access to health care, mental health, and substance use disorders and disabilities. And for fiscal year 2025, we're expecting to reach $190 million with over 800 staff. Some of the key data there, or I'm going to talk about that in a minute, is to indicate how large our numbers of households are in certain programs, particularly in our front door, the Customer Service Center and Economic Independence, now reaching 77,000 calls per year. Medicaid SNAP has gone up extraordinarily. Housing programs have experienced significant growth, as well as behavioral health. Excuse me. Next slide. So this shows the overall budget growth since 2020, and you can see that we have grown by, let's see, how much? Wait a minute, what's the percentage? 34% in expenses, and revenue has grown by 29%. The gray is the revenue, the orange is the net tax support, the blue is the expense. Now, even though we have experienced this tremendous growth in expenditures, our FTE count has been mainly growing for direct service staff. And so I'm pointing out that because we have not grown in the administrative backbone support, that's required to maintain all of these programs and run them, we are feeling a bit overburdened, and there is significant sense of overburdening by staff. Just wanted to let you know that that's transpiring. Next slide. These are the two of the programs I mentioned before that I just wanted to show you what the growth looks like. So even though, some of it has been spurred on by COVID, it did not decline in the areas of customer service and in Medicaid. So before COVID, we were at 44,000 calls per year. We're now at 77,000. And if you remember how we had touted the 1,300 number during COVID, well, that's become a permanent thing. Everyone calls 1,300 for help. So it's a lot of calls. And in Medicaid, we had expansion, of course, of Medicaid, as you know. In the 2018-2019, we expected maybe 3,000 extra households. We have 13,000 extra households. So there's another area where FTEs have not really grown, and so caseloads have become very, very high, like going from 700 to 1,200 per caseload. Next slide. This is something that I really want to talk about. This is very close to my heart and my spirit. The fact that we changed our vision, mission, values, I told you about this before, in 2022. We are committed to our vision, which is a just and equitable community that is healthy, safe, and economically secure, and free of systemic racism. We are guided by the values of racial equity, access, inclusion, authenticity, and accountability. And why are we doing this? Why are we centering race? Well, our department intersects with all of the other systems where histories of racial bias have been prevalent and are still there: health, educational, criminal, legal, employment, and housing. And we believe that by centering race, we can adjust our own organizational policies, practices, and programs so that all populations that are systemically disadvantaged will benefit. Next slide. This year, we've been working on racial equity since before the county, since about 2018. As you know, Destination 2027, our program sort of spurred on the county's adoption of an equity resolution. But this year, we took on a SWOT analysis. That was something that we learned actually through Samia Bird's, training for us. We have analyzed department-wide the strengths, weakness, opportunities, and threats in 4 domains: employment, finance and procurement, service delivery, and community engagement. We did this at multiple levels: the leadership team, the extended management team, the staff level, and have come up with many, many priorities that we want to work on to change the way we hire, the way we recruit, the way we pay people, the way we procure, which also involves other departments. And we are formulating a racial equity action plan where this will all be compiled, so we'll be providing that to you. It's ongoing work, but we should have a racial equity action plan by the summer. In terms of disaggregation, you know that we are committed to our performance measurement planning, which we've done since 2011, yeah. 13 years. We have 74 performance measurement plans, but now we have 90% of those plans disaggregated by race and ethnicity. So we can tell how the populations look in terms of their participation, their access, and their outcomes. And we also we decided to have design our own racial equity training. In addition to the foundational training provided by the county, we did an RFP, we hired Challenging Racism, and we have a 3-part, 9-hour total mandatory training for all staff that's going on this year. Next slide. Okay, this has got a lot of information. I'm going to do half, and Deborah's going to do half. So We are, much to the chagrin of some, embarking on a strategic plan. Why? We've never had a strategic plan. In fact, I think my predecessor told me, never create a strategic plan. We have a lot of foundational plans. You know, the plan to end homelessness, the age-friendly action plan, the food security plan. We have a lot of those plans, but we have never sort of brought them together to look at how we impact the community as a whole. What really are our priority outcomes? What really are our success indicators that we want to have going forward? Of course, this takes a lot of work, but we've embarked on it, and we're working our way through, and we're going to have this summer a lot of internal and external engagement through the help of a consultant. So stay tuned for next year, probably this time. I'll be sharing that with you. And of course, we have the Child Care Initiative, now called CCI 2.0. I'm very glad we have child care expertise right here. And we had to take a little bit of a hiatus during COVID, but we're back. We really had developed a very well thought out plan, so we don't think we need a new plan. We've picked it back up. We are doing a new risk and reach data study so we can refresh the data and get the accurate current data. And then we are, of course, reaching out to the county departments like CPHD and Parks and other departments, AED, that have interface with us in the child care world. And then we're going to, update the plan and have another round of stakeholder involvement that should be coming up starting this spring and summer. Public assistance. I want to alert you based, I already touched on it in Medicaid, but our Public Assistance Bureau has really done a yeoman's job. There have been changes in public assistance, like the SNAP program and child care, where the rate at which we have to respond to applications has really increased. So SNAP applications, for example, which is food stamps, now have to be all expedited in 7 days, basically. And they have removed the requirement to show no income. To show no assets, sorry. So if you have zero income, but you have savings in the bank, you are still eligible for food stamps, for SNAP. They have to be processed in 7 days. That's a stress. The other thing is childcare. They have removed not just they changed the work requirement from having a job to be eligible to just looking for work as self-attestation, which is a good thing. What does that mean, though? Lots more people coming in for childcare subsidies. And of course, we had to do all of the Medicaid unwinding. If you remember, Medicaid was not, followed through per regulation during COVID. So, we have now 31,000 households or so. We had to redetermine all of them, every single one over the last year. That's under Brooke Hammond Perez, and she has the scars to prove it. No. But guess what? We didn't get extra FTEs. We did it with temps and overtime. And so we have only 3,000 redeterminations left. So we're basically done 27,000 out of them. That's a lot of work. Lastly, there's two more. Public food security. Matt knows all about this. After we developed the strategic plan, we were lucky to get $150,000 last year. We did an RFP, a little NOFA, sorry. We got 39 applications. We awarded 10 to nonprofits. And there's all kinds of projects going on at the local level: nutrition education, fresh food, infrastructure for food pantries, accessibility for older adults, reduction of food waste. So it's really generated a lot of grassroots programming. And public health, I'll just mention briefly, Dr. Varghese is here. We took 5 FTEs from internally, from the Public Health Division, and reallocated them in order to create a new Assistant Division Director position and a whole area, much greater emphasis on developing public health's focus on population health, on building trust with marginalized populations, on conducting more health outreach, and then advancing emergency preparedness and response. So that's it. I'm now going to turn it over to Deborah.
Thank you, Anita. You can draw a breath. I'm just going to give a few highlights about some of the accomplishments in these areas. In terms of developmental disabilities programs, we are very, very proud of 1212 South Irving Street, which is our gorgeous new net zero home that will house 5 individuals, plus including a respite bed for parents who have children with exceptional medical needs. We developed a new employment access program. This is a program that is community-based. It's housed over at our Sequoia Plaza, and it's almost full. It'll have 15 slots, and once the graduates are ready to participate in June, we'll be at 15 individuals. So that's very exciting. They love the program already. Thirdly, we have expanded our Woodmont Community Integration Center, which is our day support program. We've added a sensory room and are expanding 15 additional community-based slots for individuals with developmental disabilities. And we are planning for expansion to 2 additional satellite locations over the next couple of years. I just want to give you, since we're talking about developmental disabilities, I just want to alert you to the fact that the governor has, as a priority in his budget, elimination of Priority 1 Medicaid waivers. And so we anticipate up to 40 additional waivers coming to Arlington over the biennium, which will mean an increased caseload for our day support, for our support coordinators. So I just want to give you a heads up on that. And if you're able, we are having it's DD Awareness Month, and we're having an event at Central Library on Thursday, March 21st. A film, I am able. The next piece is the mental health crisis recovery. We've been working like a full court press on this for the last 4 years. And you're probably aware that the 3 prongs are someone to call, and that would be our regional crisis call center, which is fielding 2,000 calls a month. The number goes up every month, and their response time is 12 seconds, which is pretty impressive. And our Marcus Alert Coordinator has trained our emergency call center staff in terms of levels of response. It's all about a behavioral health response to a behavioral health crisis. The second prong is someone to respond, and to that end, we've expanded our community regional crisis response work, which is managed by Child and Family Services. We, of course, have REACH for our developmental disability services, but the most exciting thing is we started MOST, Mobile Outreach Support Team. This is funded by a SAMHSA grant and consists of a clinician and a peer, a person with lived experience. They go out in a van into the community and respond to a wide range of calls, primarily around behavioral health concerns in the community. We'll talk more about that in a minute. Somewhere to Go, that's our Crisis Intervention Center, which you've heard about. We'll talk a little bit more in a bit about that. And of course, the Virginia Hospital Center, with whom we have a very close partnership and are working with them on the Carlin Springs Wellness Pavilion, which will have 96 behavioral health beds, including 24 adolescent behavioral health beds, which we have 0 now and we need desperately, plus 14 beds at their main campus for individuals with medical complications and behavioral health issues. They also have approached us about developing a comprehensive psychiatric emergency room where individuals in crisis can get treatment immediately as opposed to waiting for a psychiatric bed. So we're excited to start working with them on that. That'll be 2.5 years down the road. About a little over a year ago, we hired a crisis intervention training coordinator. She's trained 108 law enforcement professionals in the last year. We anticipate 6 classes and 120 individuals being trained in the year ahead. We're doing a lot in terms of that Marcus alert that I mentioned, and I'll talk more about that later. Coming soon in terms of places to go are 3 crisis receiving centers in Northern Virginia that are regional, i.e. we can all participate in that. One will open up in Chantilly in May, late May. One will be in Prince William County, opening in 2025, and one is opening in Loudoun in 2026. These will be for children and adults. So that will be really expanding our crisis continuum of care. Next slide, please. Okay, on to a very important topic, our teen mental health and substance use concerns. Let me tell you what we've done this year. Thanks to county board support, we've hired 4 DHS therapists to work in the high schools. We just actually have 2 starting in the schools next week. I should pause and tell you that it takes a whole year to hire one licensed clinician because of the national shortage. We've already had 57 youth referred at 2 of the high schools, Wakefield and W&L, and we anticipate that number going up. This is a great opportunity to overcome barriers in terms of transportation and, just time and accessibility for the youth that we're serving. The other piece is that we've done a massive increase in Narcan training and distribution, and just yesterday, Arlington was highlighted in a Biden-Harris release around a national call to action around opioids. So that really emphasized the partnership with the school system. Our Arlington Addiction Recovery Initiative issued a 6-year impact report. I urge you to take a look at that. I think you've received that. It's really impressive, the work that's been done. And you'll see that in an outcome measure in a second. We've also collaborated on adolescent intensive outpatient programs for substance use treatment with National Capital Addiction and Recovery Incorporated. We actually paid for the slots to ensure that youth without insurance or on Medicaid could get the treatment that they needed immediately. And VHC is also collaborating around an intensive outpatient program for substance use treatment to open late May. And then there's also a plan to open intensive outpatient services at the detention center, which is very exciting because youth often go there and can at least start their treatment while they're there and then transition to the community-based IOP. In addition, there is a little-known regional effort to develop a medical withdrawal and substance use residential program for adolescents with the support of a regional partnership opioid abatement authority grant. This grant is for $5 million over a 5-year period. I should say $5 million annually over a 5-year period. It's a substantial grant. We are looking for an appropriate location in Northern Virginia, which is a lot harder than it seems. Okay, moving on to the big picture here. As you can see, there are kind of 3 buckets that we're looking at. The county manager is proposing an overall investment of close to $2 million. This is a combination of one-time and ongoing funding to support youth well-being. And the idea is to do some piloting approaches in the near term, evaluate those outcomes, see what's working, what's not working, what we need to do differently, while we are conducting longer-term, thoughtful planning analysis of best practices, data, outcomes, and doing a whole community-wide approach. This is going to require collaboration with everybody. So you'll see in the budget that the Court Services Unit has some intervention strategies highlighted in there. DPR, of course, DHS, nonprofits, the county manager's office will be involved, the school system, and the community at large. Big picture, we feel that we need to really work towards a whole community approach to really center informed efforts and develop a plan for well-being. So we have a three-pronged approach here. You can see it's divided into buckets. One is intervention, and the focus there is around bilingual care coordination for those families that have challenges navigating our complex system of care to ensure that their children get the services that they need. And again, that will be a pilot program and will require an RFP process. The second prong is prevention. We will be conducting an ACEs campaign, which we're kicking off May 18th with the Arlington Unite event at WNL. This is going to be led by CFSD under Ms. Tabitha Kelly's leadership, and will help parents with how to strengthen their child's development. And then finally, the education engagement to include digital strategies in that children and youth well-being plan that I mentioned. Okay, next slide. I could talk about this for 3 hours. Okay, I mentioned the mobile outreach support team. This has just started July 31st. We've already worked with 323 individuals in not even a year. And of those, 32% of them were diverted from arrest. Let me say that again. A third of them were diverted from arrest. This is part of our overarching diversion strategy. The response time has been 13 minutes. About a third of them are referred to DHS, and of those, almost 70% followed through, documented. So that's cool. What we're very excited about is we had a funding opportunity to expand this team to add 3 additional clinicians and immediately. And we also have ongoing funding through the state starting July 1st. So this program is funded with no local funding. And it is serving as our co-response with the police, who are very supportive of the program. Moving on to our Crisis Intervention Center, we've served 550 clients since November of 22, when we really began to expand the staff. 45% of them are minors, so I thought that was really interesting. Average wait time of 10 minutes, and of the clients who come in, almost 80% return to the community and do not require hospitalization. And a third of them had no prior mental health or substance use history. So we're capturing people who are receiving treatment for the very first time, which is important. In terms of diversion, we are looking at a systems approach. I mentioned our Marcus Alert initiative. We have captured a lot of stakeholder input. We have an 80-person stakeholder group. We've done town halls, surveys, and so on, focus groups. And we have a mental health and criminal justice review committee that is methodically looking at each point at which an individual intersects with the criminal justice system, looking for gaps, what's working, what's needed, and developing a strategic plan to address. The need has truly increased over the last year. We've had a 20% increase in clients served. We have had a vacancy in our bond diversion therapist position, but fortunately we have a new person starting in May, so we're very excited about that. Another program that we started in the last couple of years is our behavioral health docket, pre and post arrest, and we have currently 14 clients in that program. We served 23 last year, looking at how we can expand that because that's a great success. As is our drug court, which currently has 12 clients and served also 23 clients in the last year. With regard to, and we have a number of other pieces that we're starting, an early intervention and substance use diversion. There are many points at which a client can be diverted, pre-arrest, post-arrest, and so forth. So we're looking at the whole continuum of care there. With regard to the jail, our jail team is, you can see there, 17.5 FTEs, currently fully staffed. We saw close to 1,200 clients last year. It's a 26% increase since 2020, but the numbers don't tell the whole picture. The acuity has really increased, really across the board of all of our services. We have been working with the sheriff very closely to incorporate input from the National Institute of Corrections, a consulting group, HMA, and the Falcon Group to enhance best practices, and ensure the necessary collaboration improvements that we need to make with Medico. And now I'm going to move on to output and outcome measures. Just to highlight one, we have here on the screen our adult opioid response program. Just briefly, you can see that the numbers served in our office-based opioid treatment are up 22% in just the last 2 years. The number of Narcan boxes distributed is up 429%. This has been a full court press in the last year. The number of pounds of medication collected at our 5 take-back boxes is up 55%. Again, that's in 2 years. We have noted an inverse correlation between the increase in Narcan distribution and training and the decrease in the number and percentage of overdoses. So the number of fatal overdoses in 2023 reduced by 43%. That's saving lives right there. I think that's all I need to say.
So I wonder if we should just take a quick pause, and I'll see if colleagues board members have any questions they'd like to ask
Absolutely.
this, because we're about to get into
We're about to get into the numbers.
the numbers. Yeah,
Yeah.
exactly. So before we get to the numbers,
Yeah.
colleagues, any questions at the moment? Mr. DiFerranti.
I don't always need to go first, but I do have questions.
But your light's on first. So.
And I always felt when I was chair that it was nice to have someone to go to,
Yep.
for the record. So,
Otherwise, I have to call on someone.
this question is, starts with a thank you on the MOST program, and disclosure that I have sat in a couple of times on the mental health intercepts type, trying to listen and not surprise anybody, but just engaging because it's important and interesting to me. And that, so I think we are adding capacity, and it seems like a follow-up place for questions would be, I feel that the job of doing most in the evenings is a different job. Somehow now I feel like when I'm out in the evenings, that is something that I prize. And so you don't have to say much, and I'm mindful that this is not an easy thing to do. I'm not particularly asking those who are staying to 7 to change and stay until midnight or 2 or 1, but that is where the biggest need for this is likely to be, as I think we know. And so just disclosure that I might be trying to find more money to, and I know that there's tons of places what you guys would want more resources, but being open for most between 7 and 3 in the morning keeps me up at night, and I know it would be important to you. And so I just don't know if you can help me with the barriers, or I'm not trying to be annoying, I'm trying to address a need.
Right. By adding the additional 3 clinicians, we will have a supervisor. First of all, that's important for this. We will have a clinician and a case manager, and the plan is to expand the hours. So we're looking at exactly what you're talking about, the number of calls coming in per hour. We're looking at that pattern so that we can determine where best to have our staff work. Well, right now it's 1 to 9.
1 to 9.
Right
So-
now it's 1 to 9. We have 1 team. But with this additional funding that we've just received, we'll be able to expand the hours. We also want to have weekend hours as well.
Great, and I'll follow up. I just wanted to at least mention it without getting into the weeds there, but I'll follow up on that one. So I might have one more, but go ahead. Others.
Ms. Cunningham.
I would love to, well, first of all, to say thank you to your whole team. I know, in part, I've seen glimpses of just how incredibly hard everyone is working and the talent throughout the team, so thank you. My first question is around the teen engagement and prevention strategies. And you talk about, we're kind of entering a time of doing a bunch of pilots so we can learn quickly and use our resources effectively. And I'm wondering, do we have academic partners or other partners who are helping us structure the measurement of those pilots? How will we step into that? And then corollary question, how many of the teens that we think we will be serving are non-English speaking families? Do we have a rough idea?
Well, the youth where we're focusing our intervention strategies, APS would call them the tier 2, tier 3 students. The youth most at risk in terms of certainly substance use that we're seeing are non-English speaking families. And that's why the priority is on that bilingual case management to help them learn about the system, help support the families navigating the system.
Great, so it's the majority of them, or 90%, or it's very high?
It's very high.
Okay. And then on the question about the pilot creation and measurement plans.
About the measurement plans, we haven't gotten that far in our planning yet, but I do think that, we're surrounded by universities. That's a great idea.
Got it.
Yeah.
Awesome, thank you.
Okay, great.
You want to add to that, Anita?
Well, I know we've discussed adopting certain materials from different organizations, universities, and national associations for some of our campaign work with regard to ACES.
Great. All right. Ms. Coffey.
Thank you. I'll start on the topic of housing assistance and eviction prevention.
We haven't gotten to that.
Oh, is that still to come?
We have a whole presentation on the section, that's part 2.
Okay, I will hold
Yeah.
those questions and we'll go to childcare then.
You want to go for childcare? Go for
So
childcare.
much to talk about. So I know a lot has changed with the requirements, especially for subsidies at the state level. Do we maintain a wait list locally for how many families, and do we know about how many families are on that wait list right now?
Are you talking about childcare?
Yes.
We don't have anybody on the wait list right now, right, Brooke? No. Come on up, Brooke.
Join us.
That's why,
There are millions watching, and they need to hear.
yeah.
Thank you.
Press the button.
Yeah.
Technology. There is no wait list. In fact, we unfortunately leave money on the table every year in our local childcare subsidy dollars because we are having a hard time finding providers to accept the subsidy. So that's the issue. It would be a good problem if we had a wait list,
Right.
but we have the opposite problem. But we have done everything we can to eliminate all of the barriers. We pay up to market rate with our local subsidies. We don't require all the crazy paperwork that the state does, but even so, we don't have providers that want to accept the subsidy as frequently because there's so many people in the private, citizenry that can pay full market rate and
Yeah.
they don't have to jump through all those hoops.
Oh, yeah. So just to state this back, so we have many children who would take a subsidy spot if they could find a subsidy spot, but we're not putting them through the qualification process because we know that there is nowhere for them to go, even if they theoretically.
No, we never turn anyone away. No.
Okay.
No, we never turn anyone away because we can get more money. And I'm looking at the child care recipient data that you sent me, Brooke. In the beginning of 2020, we had 192 child care subsidy recipients. Right now, we're up to 356. We did have a wait list back in 2020, before COVID, I think it was. And we cleared the wait list and we brought in as many we could. And I think we even went back to the state for additional dollars. But now we've reached the point where we've saturated the available subsidized units and slots that are in the childcare. So what we really have to do is push providers to accept subsidies. And we're hoping with the childcare NOFA, with the $4.5 million, which I think we've already gotten a bunch of proposals, but it's not finished. There's the,
Building it out.
the building out and the investment in infrastructure in exchange for reduction in costs.
Yeah.
Subsidies.
And I will just add to that, we've seen that increase in state subsidy numbers because of the relaxing of eligibility requirements. And I asked the same question, where are they going? because I mean, I've been told by my team all the time there aren't enough providers to accept the subsidy. They're going outside of Arlington. So
Okay, understood. Thank you. That's really helpful.
Yeah, before you go, I think what you're getting, are you able to quantify, so there's an unmet need, that's what but it's just, there's an unmet need for a lot of reasons. Do you have a sense of what that is, how many children that is in Arlington?
Is Caitlin Hutchinson on the line?
I am. I'm here. We don't have hello. We don't have the updated risk and reach data quite yet. We're anticipating it will be completed in the next couple of weeks, and that may give us a better sense of what that data looks like right now. I think we could look and perhaps get back to you about how many of our households that currently receive a subsidy use it with a provider outside of Arlington, because I think we could get that information, but that may not give you a whole picture. And it also may not always indicate that they can't access care in Arlington, because we did find the last time we conducted some surveys with families that some families did want to access care outside of Arlington because of, their job being located elsewhere, for example. But we're hoping that we'll have some additional data that we can share in the coming weeks.
Thank you. Yeah, I was mostly looking at unmet. I mean, if a child's getting served elsewhere, that they're getting served, but mostly people who really need and can't access. I'd be kind of, when you get that number, be interested in it. Thank you.
Yeah, we will get that to you.
Yep, Mr. Karantonis.
Thank you. Two questions. First of all, one big picture question, because I hear loud and clear, and this is the third time that I have the honor to be here discussing this, and it's a repeating pattern. You're understaffed. You need, the caseload is skyrocketing. The needs have been constantly, increasing. Actually, through the pandemic, we have seen that people who we haven't been seeing before, now they know how to access services. At least they know how to access them far better than before. So we have a better idea of what the needs are in the community. And at the same time, it's not very easy. You mentioned that for clinicians, it's about a year to hire somebody. So we have a problem in the workplace, in the labor market. So my question is, and we had these conversations before, what does the department envision doing to try to create a workforce from within? So to use apprenticeships, to use internal professional development, so that we get the critical skills to at least fill the most demanding gaps.
Well, that's a great question, Takas. There's a number of things that we have been doing over the last few years, and Marcy Foster, is really been my, working very hard to help support our department. The number one, in the area of public assistance, where we have like dozens and dozens of staff, we had kind of an antiquated structure where the staffing were all the same. They were called eligibility workers. We worked with human resources. It took some time. We now have changed the name of eligibility worker, which is kind of demeaning, to public assistance benefits specialists, and we've created tiers. So there's actually an upward mobility now of tier 1, tier 2, and you can become a senior public assistance specialist. And so that's one thing, but the attrition is high because we're in competition with the neighboring jurisdictions. They all have the same Medicaid, SNAP, and TANF programs that we do, and they pay more. So that's another thing I've been working with Marcy on. We've sent many compression analysis over to her, many requests to reconsider what our salaries are. And as she's doing, they've done as much as they can, but we're not always the most competitive salary-wise with some of the areas. In terms of internal mobility, aside from like the pathways that we have, we also have that in behavioral health. You can become a resident supervisee, then you become a therapist, and you become a therapist 3, I think, and then you become, so it's a whole series. We do have a lot of management interns that we hire, and we've been very successful with that. I think we have probably a dozen now, Corey, I don't know, something like that. And typically they end up working for us in the long run after their internship ends. But that's a good pipeline. There's always more that can be done. So if you have any good ideas, let me know.
I'm very interested in that.
Yes, I would
think
appreciate
that it's I guess this will be one of the issues that your strategic plan will be addressing.
Yes.
I don't foresee, I mean, I cannot see how we are not going to be in a continuous stress in the
Yeah.
coming year. So the better we organize to create our own workforce for our needs, the better we will be off eventually. And if this requires some sort of advanced investment in that, we need to know that.
Yes.
Okay, thank you.
I'd
going
like to follow
yield.
up on that a little bit, and maybe it's more for the manager. So what I heard you say is that we're not the most competitive, and you talked, looked at pay ranges, and somehow we can't do that. Is that a policy? Do we need to change a policy, Mr. Schwartz?
What happens is, as soon as we upgrade our salaries, the other ones are upgrading their salaries. You know, we, for example, fought for bonuses. The manager gave us bonuses. Well, Fairfax decided they were going to give 3 times the amount in bonuses, you know? So it's sort of this, every time you do something, the other jurisdiction is sort of, you know.
But that's the world we live in. I don't know. Mark, do you have any?
Well, yeah, we're constantly monitoring that, and I know Anita is many things, but she is not shy.
I take that as a compliment.
It is.
In your line of work, it is.
She has come to Michelle and me, and we have addressed that as we can. And frankly, it's a challenge because, as she said, we up our game, everybody else is upping their game. So, you know, that is, I wish I had the answer to that. I really don't. But we're not going to unilaterally disarm in this race. We can't afford to do that.
Right. Okay, thank you. That helps a little bit. Well, we need to move on to the numbers. Thank you very much. I will tell you, despite all of the incredible amount of need we have, in my 12 years, it feels to me like we have a lot of programs in place now that we didn't have before. And that you were here at this table saying we need to do this about 5 years ago, and it's actually all now, it takes a long time. But it really feels like a lot of it really is coming into place. The mobile units, the crisis, I mean, it's incredible. So at least we're making progress.
Yeah.
But of course, it's a little bit like Sisyphus, I guess.
Yeah.
And this, keeps getting more need. But thank you for what you're doing.
No, I always say that's the wonderful thing about working in Arlington. I say it to my staff in their new employment orientation. You can actually take things from a concept of a need, put together a plan with very intelligent people, community and government, get resourced, and implement it and see it in action.
Which is exciting.
That's-
And then we measure it
that's
and make sure it
motivating.
works. Yeah, great, thank you. All right, I think we should get to the numbers now. Thank you.
Okay, and now for the numbers. Well, here we go, folks. It makes me nervous to even say the amount. We're at $190,690,584 proposed for fiscal year 2025, a 2.9% increase over the current year, and our revenue has luckily increased at the same percentage, and our staff is increasing by 1.1% to 803 FTEs. I don't know how you can have a .52, but okay.
Something about numbers.
Let's go to the next. This is some news that you need to be aware of. We have, remember the County Board Awards? Remember all the nonprofits
Yeah.
with the County Board Awards? And you all said, why do they come every year and ask us for more money? Okay.
That was a generic county board member, not.
No, not anybody specific. So that, we created the Racial Equity NOFA, the Rebuilding Trust in the Community that's being managed under the Chief Racial Equity Office. But some of these that were county board awards could not be put into a nonprofit NOFA, and they needed to be competed. They had not been ever competed. For example, Sullivan House, or for example, Doorways, Safe House, or for example, the Hotline. So this year we are conducting five RFPs, and Purchasing is tired of hearing from us, but what can we do? And we're we have new RFPs for the Woodmont Adult Daycare because of the expansion. We have Volunteer Arlington, which came up after the 5 years and needs to be renewed. There was a massive security RFP that was, I think, countywide. We were a part of it in terms of our own guards and the SCOPs. Project Peace, that's where we have all the the sexual violence, domestic violence prevention programs, the the Safe House, the Hotline, Revive. The homeless shelters have been competitively bid before, but only 2 out of 3. Homeless Services Center and RPC were competitively bid, but not Sullivan House, the family home. So that's in here. And AFAC is going to become a sole source, but you know that they are woefully underfunded because of the number of households that are receiving food assistance and the price of food. So what all this means is that costs are going to go up due to these competitive processes, and we never really funded some of these at the true level that they needed to be. So this is about $1.9 million of an increase that the county manager supports. Thank you, Mark. Okay, next. The following are the lists of the reductions, and I'd rather go over them one by one, so I'm going to speed ahead. The reductions amount to $975,413 amongst these FTEs. There are 8 FTEs being proposed to be reduced. 6 are filled and 2 are vacant. Now I'm going to go down. Can you slide? Go ahead. One more. Okay, I'm just going to go one by one so you know what they are very quickly. Okay, well, tuberculosis. Tuberculosis, fortunately, active TB has declined in Arlington. That's a good thing. 45% decrease since 2020. So we decided perhaps we could live without one outreach worker because we don't need as many people going out. That's this filled position. It's a clinic aide, and it's $102,281. Next. This is a planning and education supervisor. I mentioned the reorganization that public health had. As a result of the reorganization, this position became unneeded. And it's filled, but the existing person has an opportunity to go to another position within the department. Next slide. The dental program. Everyone always loved the dental program, and it's our Dr. Paul Rapavi has been with us for a long time. He's like a saint who walks among us, and but he's retiring. And where are we going to get another dentist at the price of a dentist? And the clinic aide became vacant. And then we thought to ourselves, well, this could be an area which a nonprofit could do the work. We have the infrastructure, we have the chairs, we have the office, we have all the stuff. We just need a nonprofit to come in and run it, of which we have a couple out there who are interested. And so it's going to be transferred to nonprofit management, and we are able to save $165,000. Next slide. Employment services specialist. Another thing that we're going to change the way we do our business. In the Arlington Employment Center, we manage various streams of money. One is WIOA, Workforce Investment Opportunity Act from the Department of Labor. We are going to outsource the training and supportive services to a vendor and eliminate one filled employment services specialist that works on WIOA programming. Next slide. Teen Network Board Coordinator. We have merged we had vacancies in the Teen Network Board and in the Arlington Partnership for Children, Youth, and Families. So we decided we could combine the two, that the liaison for the partnership and the person who runs the TNB could be one and the same. That has allowed us now to eliminate what was a vacant program specialist at $136,000. Next slide. Okay, this is BIS, the Behavioral Intervention Services. That's a program that's been in Child and Family Services for quite a while. Decades. It provides voluntary, individualized, behavior-based coaching to the caregivers, not to the kids, to the caregivers. They basically last year served about 93 clients, and there's been a 24% decline in the clients. Now, we looked at, there's been some controversy. I realize, we've received letters and things like that. I wanted to point out, number one, the school system has behavioral intervention specialists, 5 of them. Secondly, the majority of these families are not low income. They are paying full fee or don't even do the financial assessment because they agree to the fee. And they are not BIPOC families for the most case. So some of the, interpretations that have been presented, I think, are erroneous. Sure, is it painful to have people be, position eliminated? Absolutely. But there are other resources. And in fact, Tabitha Kelly sent out to all of the families on May 6th a letter, I don't have it with me.
I do.
With a very substantial matrix of services, alternative services. Because basically, by the time May rolls around, there will only be 19 clients left in this program. Oh, May 6th? I said March 6th, sorry. Thank you. Thanks for correcting. So the costs, the savings is $277,093. That's the end of our reductions. And in our key budget considerations coming forward are the areas that we've discussed already. What will it take to implement the full Marcus alert? We're working on that. Of course, one doesn't know where the final, needs will be. Hopefully, we'll be able to stick to our $1.9 million for those increases in contracts. And then, just to consider that the strategic planning will mean that we're probably going to make some reorganization to the director's office. Our director's office looks exactly the same way it did when Suzanne Eisner left. And Libby knows Suzanne.
I do. That's just how long ago it was.
That was a long time ago. So we've been basically managing with the same level of staffing, and we need to, given our growth, we need to look at how we are staffed and how we're structured so that we can really support all of these initiatives well, and perhaps reallocate resources from within according to where the needs are indicated. That concludes my presentation for today. I want to thank everyone for their time.
Thank you very much. We have several commissions. We'll hear from them, and then we'll take Kylie's questions after that, if that's all right. And I've got on the top of my list is Wendy Crawford with Community Services Board. Is Wendy here? Excuse me? So I don't want anybody to take it badly, but this is a 3-minute timer, and when you start, I'm just going to go like that, and it's not saying that you have to stop, but it's just to be aware because we have a lot to get through. But we do want to hear from you, and I know you are succinct, Ms. Crawford. Yes, there we go. Thank you.
Thank you. I will talk very quickly, and I did provide the letter ahead of time, so you
did,
to read
and
as
we
well.
really appreciate it. Thank you.
But I do want to say I'm Wendy Crawford. I'm the chair of the Community Services Board, and I'm the chair of the Child and Youth Committee, and I'm delighted to be here this afternoon. I want to start by expressing our deep gratitude for the support that you all have shown historically and in the current budget. Thank you so much. We're deeply grateful for all the programs and services to people with disabilities and behavioral health needs. And because of your support, all of the broadening and deepening of the continuum that you've heard about this afternoon has been able to happen. And we heard examples from the the CIC, the Crisis Intervention Center, which is so critical to keeping people in the community and supporting them in de-escalation. Much appreciation for the floor clinicians coming into the schools and really breaking down some barriers for our youth to access services, and for the group home that we heard about for the people with developmental disabilities and complex medical needs. And these programs are yielding positive results. And you heard the data in some of the services this afternoon. We are seeing reductions in fatal overdoses, which is not something every community is seeing. We're very, very, very happy about that. So thank you. Thank you so much. We know it's a challenging budget cycle, and these are not easy things to look at and decide. So thank you. We're glad to see the continued focus and especially the planning for ongoing engagement around the needs of children and youth through the ACEs, Adverse Childhood Experiences campaign, the intervention supports, and a child and youth plan. We're excited to see that because it reflects our shared value of engagement and collaboration. And we believe that those supports will create a robust, ongoing, and continuing process for community engagement, which is so important to hear the voices and to identify needs together and respond to those needs. We are asking you to consider the increase in needs of our very young children, you heard birth to age 3, by converting existing temporary positions into permanent support coordinator positions. These already exist, but we see the need, and we want to point out that there's a lot of research that shows us that early intervention is very powerful and cost-effective to the community, with the 1 to 16 being a research-supported return on dollars spent in the early childhood arena. We also, as the CSB, want to encourage the board to consider the points raised about the governor's budget and the Priority 1 medical waiver list, and supporting the needs that we will see here locally by adding an additional support coordinator each year to make sure that those individuals successfully transition into the programs and services that they need. We want to take a half a second and look ahead and just highlight that we do foresee continuing needs for people with mental health needs and the group home situation, because we have 22 people whose needs are not currently met. But thank you very, very much. That's 2 minutes. I practiced for 4.
No. You can actually, if there's, no, if there's a little bit more, because you spent at least a minute thanking us.
Yes.
So, people do not have to necessarily do that, but if you have anything else that you really would like to say that you missed, that's fine.
I do want to make sure I thank the DHS. I think they do another thank you, but it's amazing the creative problem solving and the efficient use of resources and pursuit of grant money to fund things that we really need. And I just cannot leave here without saying thank you to those folks.
Thank you, and we need to thank you, because everybody works really hard here. We do get paid, maybe not a whole lot, but we do, what the CSB does is basically volunteer. And it's wonderful and absolutely crucial. Thank you so much. Don't go away, we might have questions for you. Don't go too far, because we'll have, I think, Carolyn Romano. Carolyn, did I see you here, I think? Yeah, there you are. Come on up. The chair of our Commission on the Status of Women. Hello. That's okay. That's all right. You do a lot of work. No, push again push one more time. See that red button? You're good.
Now it's on.
You're good.
So I was just saying that I can be short because I didn't prepare testimony other than this sitting back there. You like that? On the fly. And the reason is because I'm busy and I'm tired. And our commissioners are also very busy and tired. We are working women, parents, caregivers, single parent caregivers, lawyers. There's a bunch of us. We have a law student. She was supposed to work on the testimony, but she was working on a moot court brief, and I sympathized with her and said, Jordan, next year. So I thought to myself, what can I do off the cuff? Libby, you probably know I probably could have come in here and railed about sexual assault, sexual violence data, and that we should do more with Project Peace and these sort of things. And I thought, well, yeah, I could do that, but that's kind of boring. And I thought back to the county fair last summer when we met one-on-one with community members for 3 days straight. And the number one topic that people, men, women, children, teens, whoever came by our table wanted to talk about was periods and perimenopause and menopause. I'm in a unique position that I've experienced two of those things. And so I didn't have any recent firsthand experience about period products. I exchanged period products for hot flashes and insomnia, this weird drip that comes from my nose that's not explained by another reason, joint pain. That's good enough for now. So I stopped by CVS on my way in here to get tampons and pads so that I could remember, well, and inspired chocolate. You can't buy one without the other. The cost of these two items here was $23.78. They were tax-free. Thank you, Virginia, for finally recognizing the period tax. Nationally, the estimates are about $6 to $16 a month for women and girls for period products. I don't know, I guess it depends on your flow or what brands you like or whatever, but like I said, this set right here cost me $24 this afternoon. Virginia law mandates that schools provide period products in bathrooms for grades 5 through 12. You guys know that, I think we've talked about it here before. And just this past year, again, an amendment to the budget in Virginia failed to provide, I think it was a $250,000 line item that would provide funding to local school divisions to fund the dispensers to put the products back in the bathrooms. We also don't have, in Virginia, a compliance mechanism for making sure that we're complying with the law to have those products there. I haven't gone around and snooped in all the bathrooms in the county, but I did find myself at Swanson Middle School last spring, helping out with cheerleading tryouts, which was super fun. They definitely didn't have any period products in their bathrooms. I guess dry mouth is perimenopause too, huh? But one of the teachers we were working with, one of the cheerleading coaches, had a great supply on her back shelf. So teachers are taking it upon themselves still to make sure that their students have the products that are needed and available. Because what we know is that women and girls who have periods and have period poverty are not going to show up to work. They're not going to recreate. They're not going to be able to go to school. And that's something that is undignified and something that we can fix. So I don't know where it is in the budget, but I started looking at the library facilities budget. I looked at the recreation center's facility budgets to see if we can, I don't know, when you guys meet with those folks, ask them about their facilities and what it'll cost. In Lynchburg city schools, they estimated about $4,000 a year to put the dispensers in, but I think the county facilities should have them. For sure, the recreation centers, if we're making great strides in the schools, that can be a model for putting the dispensers in there. I checked this building on my way in, why not? There's not any in the gender-neutral restrooms, and I don't have a recommendation for that, if you would put them in all of them or flag one with a period sign or something. But up here, it's still a coin-operated machine, and I think you saw me in there snooping around, didn't you? I don't have any coins in my pocket. I don't think I have any in my purse for sure, so I don't know how women in this building, if they find themselves needing a tampon or a pad, operate the coin machine. But that's what I wanted to talk to you about.
You're right at 3 minutes. You're perfect. Oh, I did? You did it. Perfect. And good point. Really good. Well, we'll ask them for some information. Should have thought about it, but it's been a long time since I've needed the products.
Right.
All right. Thank you very much.
If anyone needs a
Thank you,
tampon,
Karen.
a pad, or
Yeah.
chocolate, I'm in the back row.
Take care.
over
Enjoy
there.
the chocolate back there. Good. All right. Thank you very much. Excellent point. Next is Elizabeth Priel, Chair of our Disability Advisory Commission. Elizabeth, are Elizabeth here?
Yes, I'm here. I'm
Yep.
one on the phone. I was
That's
I was
fine.
not able to make my Teams work, so I apologize for that. I will just describe myself. I'm a white woman with glasses and blonde hair, and I'm the chair of the Disability Advisory Commission.
Thank you. Can you lean a little closer to your microphone because we can hear you, but just barely, Elizabeth? Ms. Priel.
Oh,
That's
okay.
good.
Is
Yep.
that a little bit better?
That's a little bit better.
Okay,
Mhm.
great. A little bit better. All right. Is this the time where you wanted me to do my presentation?
Yes,
I'm
please.
sorry, I was off.
Yes, please.
Okay, great. I'm so sorry. Just one second. I am very pleased to present on behalf of the commission, and I just wanted to also commend earlier in the meeting hearing all of the work that's being done on behalf of mental health services, crisis-based mental health services, mobile crisis services. And I just think that's really exciting, and I really commend the the county for being so progressive on implementing new mental health programs, as well as the report you had on creation of new residences and respite care services for people with developmental disabilities. But that was sort of an aside from me. I just was really excited to hear all that's been done. And I'm also on the Marcus Alert Committee, and I want to say that's been very well facilitated by the county, and I'm excited by all the different variety of county staff and variety of stakeholders that they pulled together. I heard you say it was 80, and that doesn't surprise me. When each time I join the call, I see the variety of people. So that's just kudos to the county. As far as the Disability Advisory Commission, we do have some areas where we are hoping that you could consider for inclusion as far as budget priorities. The first would be that we are very hopeful that you will be part of the other Virginia counties that are helping to support the deficit in funding of the metro system. And the reason it's so important for the Disability Advisory Commission is that many people with disabilities are not able to drive for various reasons and depend on both Metro and Star for services. And so because of the budget shortfall and what we hear is going to be cuts in services, that's really going to impact the ability of people with disabilities to not only get to their jobs, but engage in other activities in the community, which are so important for our disabled citizens. So that is our first request. Our second request has to do with the need for a specific full-time, hopefully, but at least part-time, disability county staff that is responsible for ensuring compliance with both the ADA and the Fair Housing Act. We've actually been asking for this at every meeting that we have with our board representatives. So it's been for at least 5 years. And the reason it's so important is because right now the county code office is only responsible for ensuring compliance with the Virginia Code. There is nobody, as we can tell, in Arlington County that is responsible for ensuring compliance with the ADA and the Fair Housing Act. And this leads to an unfortunate situation where people are actually coming to the Disability Advisory Commission and asking our help to ensure compliance. And we are just not equipped with that level of expertise or that authority to be able to know whether compliance is necessary or even know what the county has done. And it's been a problem for a long time, and we basically know that requirements of the ADA and requirements of the Fair Housing Act routinely are violated, and there's nobody in the county that's gathering all the reports. There's nobody in the county that's collecting all the complaints. And without this information, then the county doesn't have any reason to make a priority on complying with the ADA and the Fair Housing Act, because nobody's collecting complaints, and nobody in the county knows who to go to make those complaints. Another reason we think it's important to have a representative is for the county's vision plan right now, there's nobody in the county that's ADA certified, as far as we know. And so when the county looks at its overall vision plan, we don't believe that there's anybody who's incorporating disability accessibility issues. And that's so important if you're going to have a major plan like this. And lastly, we want somebody, this ADA and Fair Housing Coordinator, to be somebody that can take the complaints and can maybe every 3 years, maybe every 5 years, do a survey of Arlington County citizens with disabilities and find out what the major needs are, so that these types of things get reported to the county on a regular basis, as opposed to a hodgepodge basis. So those are our major requests, and I appreciate your listening to them.
Thank you. Those are excellent requests, and thank you for bringing them to our attention. We'll continue. We'll have some questioning, and if you want to stay tuned, I believe we have some information on the fair housing. I think that has been stood up again. I think there was a pause, and certainly these are serious issues, so I really appreciate you bringing them up, and we will be discussing them, at least some at the moment, and looking into.
Great, I'll be listening.
Thank you. Thank you so much. Yep, thank you for everything you're doing. And our final commissioner is, for this section, William Way, Commission on Aging. William Way?
Yes, I am on by video. Libby,
It's
I
nice
hope
to
you
see
all
you.
can see me. Great, thank you. So good afternoon, county leaders. On behalf of the Commission on Aging, I am William Way. And I am the chair of the Arlington County Commission on Aging, as you noted. So my remarks will be divided into background, some concerns, and a conclusion. I'll provide some headlines just so that makes it easier to track. For background, I'm a proud Arlington resident and a passionate advocate for older adults and an age-friendly Arlington, especially ensuring the availability of safe and accessible housing and transportation options for all older adults. I'm honored to join you today to share highlights about an invaluable natural resource in our community. The 38,000 older Arlingtonians age 60 and older who make up 16% of our population and are growing in the next 3 decades. Older adults are vital to our economic spending tax base, workforce, and volunteer corps, not to mention our commissions and advisory groups. Our experience and national trends tell us that most older adults prefer to age in place. You've heard that before. Many of us have raised our families here. I've been here since before 9/11 and have established our community and natural supports. These are the things that we will lean on to successfully age in place. So next, some concerns. Housing. The Commission on Aging is very concerned about the growing gaps in housing affordability, especially for lower income older adults. Programs like housing grants help, and we are grateful that this program continues to be open and available to this population. So we ask that you continue to support more housing overall, as well as more affordable housing. So more housing overall and more affordable housing. Homelessness. We're concerned about the increase in homelessness among older adults in Arlington, primarily due to the lack of affordable housing. Metro Washington Council of Governments has found that older single adults are experiencing homelessness at a much higher rate than other single adults. Transportation and medical costs. We're concerned about continuing trend of older adults struggling with increasing transportation, prescription, and medical costs. And we, just as the previous speaker noted, we join the Disability Advisory Commission's concern about funding for Metro and STAR, because many older adults are also disabled. Equity. These trends endanger equity because they place crushing weight on those older adults with the greatest social and economic needs. They're also forcing some of our older adults to move to neighboring communities, a loss to our own community, but also a hardship for the person who suddenly finds themselves torn away from the support system that they have built up over the years. Next, the county staff. We value the hard work and effort of all our county staff, especially the Department of Human Services and the Aging and Disability Services Division, who serve as the front line in supporting and advocating for older adults, persons with disabilities, and their caregivers. The demand for their services continues to grow significantly, as noted by our DHS leaders. Some examples include Aging and Disability Resource Center that continues to respond to an exponential increase in contacts per month for financial assistance, utility cutoffs, and food insecurity and in-home services. Adult Protective Services, where the number of reports of abuse and neglect of older adults continues to rise and includes a dramatic increase in the reports of financial exploitation of older adults. Mental health, increase in the number of older adults living with chronic and pervasive mental health served by our senior adult mental health team. So in conclusion, on behalf of the Commission on Aging, I ask that you continue to address the growing older adult population and increase the resources to support older adults. Commission is hard at work on our next 5-year age-friendly action plan and look forward to briefing you. Our goal is to ensure Arlington continues to lead the way as a livable, vibrant, and fulfilling community for all ages. So thank you very much.
Thank you. Thank you very much, and thank you to the commission. All right, colleagues, questions? I'm hoping 15 minutes, 20 minutes, maybe not more than that, if possible. Who'd like to start us off? All right, we'll go to Takas just for a change of pace. Start us off.
Okay. When we talk about human services, everything comes together, right? So everything is connected, and you're in the middle of it. So one question I have that's on the proposed changes, your slide number 12. These are the now competitive contracts. So one of the reasons why these were always a tough conversation before is, among other things, they didn't have cost of living or adjustments, etc. And some of these contracts were running for quite a long time, and while we were expecting them to be more productive and serve more people, the appropriations were more or less flat or not increasing accordingly anyway. So are these increases of a total of 1.9 million now responding to these gaps? And if yes, what's the outlook?
Yes, that's what we're intending to. I mean, for the vast majority, the increases are due to costs of inflation and personnel costs that have to be adjusted to the current standards. There's a couple of items where I think we may be changing sort of the methodology. For example, I think I neglected to, no, that's in my other slide, but Doorways is discontinuing family homeless services. They're going to become only the DV providers, right? And so they're closing the family home. They're actually moving the safe house residents into the family home and getting rid of the safe house, which was a private residence in an undisclosed location.
It should be.
Yes, but that means that the number of beds that are going to be available for victims of domestic violence will increase beyond what they are now. And as a result of the lack of then a family shelter, we have plans in this RFP to find alternative kinds of housing, scattered site or emergency lodging to accommodate the lack of the family home. So that also drives a little bit of the cost. But a lot of it is just basically due to the cost of doing business is not the same as it was, when we had these contracts initially.
Oh, absolutely. And I'm conscientious of the fact that a good part of this funding goes into creating and sustaining the infrastructure that needs to be there in order to be able to provide the services. So certain certainty and predictability of these contracts is as important as the from time to time competitive check on the cost of these. Thank you for that. I yield, Madam Chair. I have another question for you.
All right, we'll keep going. Maureen?
Yeah, thank you. I wanted to ask a couple of questions about the behavioral intervention services. And I think Deborah or one of you mentioned that there was a letter or an email that was sent out that details some of the other options that families have available to them. I think, in hearing from some of our school board colleagues and the superintendent, they don't feel that they are able to provide the same thing that's being provided through BIS right now. And so I think I have some concerns about making sure that that families have these services available to them. But also, you know, could you provide a little bit more detail about what it is that BIS is doing on the ground so that we have a good grasp of that?
And Deborah, pop in here. We also have Tabitha Kelly, who's from Child and Family Services. You want to come up, Tabitha? So basically, you know, BIS is parent behavior-based coaching or caregiver. It's not for trying to get the child. They don't have any clinical background, the two people who are. They do not make diagnoses of the children's, you know, clinical status. They are called in typically by schools, right, Tabitha, to go into the home and do the coaching and the behavior modification. Schools don't go into homes. This is a rare service, I think, but there are alternative ways to access coaching. You want to talk about it, Tabitha, a little bit?
Sure. And thank you all for your time. Yes, so the behavior intervention specialists do provide a service where they observe the child in the classroom. They can make observations and recommendations to parents. They also can observe the family in the setting, but they primarily deliver recommendations and create a behavior management plan for the parent. So this is a parent coaching model. They do not do any diagnosis. As we look at, you know, the transitioning the program because of the budget cuts, we did in fact identify community providers, and we're also looking at bolstering the capacity of our own internal staff to be trained in behavior modification so that we can offer that to parents in group settings and to individual clients that we serve as we go out into the community visits ourselves. So that's another mechanism by which we're trying to build the capacity. We have a cohort that is slated to be trained in a behavior modification model. Hopefully will be completed by mid-May. Called Flip It. And it is an evidence-based model based in behavior management. And we also partner with our schools. Although the schools refer to us, they also have behavior intervention specialists located in the schools as well. So there's a variety, a continuum that we're trying to build and strengthen to make sure that we have the resources that parents need.
Yeah, thank you. And I think if we can just follow up with the matrix that you were able to put together,
I
that'd
have
be
it,
great.
but I don't know if I'm allowed to fill out because I only have one.
You got to pick your favorite.
Okay. All right, I don't want to
There you go.
violate any rules.
And I had one follow-up question, if I might, Maureen, want to, so did you considered, so the need went down, you cut 2 positions, did you consider cutting 1 position? So that you'd have 1 behavioral specialist left? I mean, that would seem to be
No, we did not. We looked at efficiencies, you know, Mark's instructions were look at programs that are, you know, really not in high demand. This is not in a high demand situation. And we prioritize children who come from households with low incomes. These are not children from low income. I'm not trying to be discriminatory in the opposite way, but, you know, there are resources available also in the private sector that people can access.
Mm-hmm. And can we help them find those
Yeah.
resources? I mean, somebody coming, all right, well, I will take a look at this information. And,
Yes, we have a transition plan for each family that is not completed, right?
Correct. We're working with each family currently to determine where they are in their progress for discharge. Several have already ended service. We've identified 19 families who may not close by the end of May, and we're working with how we will refer them, or if they decide, if we further assess as we get closer to May that some families are ready to be discharged, then fine. Otherwise, we're going to support them in linkages to community resources.
Okay.
Can I just,
go ahead.
how many of these 19 last families can be considered challenged in terms of, finding services outside the system? Probably not many.
I don't think we have the overall percentage, but I think we had 30% of the overall caseload is low income.
30%. So
30%. So 30% of 19 would be like 6.
Yeah.
okay, I understand.
right.
Typically, the last are those who are most challenged, so we'll maybe a little bit more, but I understand the order of magnitude was important. Thanks.
Yeah. And I just want to say, I mean, children with behavioral difficulties, no matter what your income, is really hard. And you want to make sure that all these kids come through because it's so. Anyway, I appreciate, Maureen, you raising the cop. We have totally pounded on you, on your question. Did you have anything else you wanted to? We piled on. Was there anything else you wanted to ask?
I think, the only thing I had, I think, was, I think the, Commission on the Status of Women raised interesting points about period products in particular. It's something that I've, seen advocacy for on a lot of college campuses and through schools, but I think the point about public buildings is well taken, and I know we do have community health initiatives, and I'm, maybe this is not the moment and the place to propose something brand new, but looking at in the future how we can interact women's repro health into our community health initiatives is something I'm interested in.
Yeah, I'll second that. I'm very interested in sort of an overall estimate of what it would cost to put period products into a lot of our public buildings. It really makes a whole lot of sense to me, so I'd be interested in that. Not saying that we need to do it, but I don't know if we've even looked at it and gotten an idea of what it would
Not
cost.
an area we've explored until, but always happy to help.
Yeah.
Thank you. All right. Next question down the other side. Ms. Cunningham, Susan.
So following up on Tax's question, I think where you were showing the proposed 1.9 for nonprofits, so it's page 12, I think, or slide 12. It suggests here that, are these new expenses? Is there a what we were already paying for these in '24? What's the delta? We can get that offline.
Know
if
the
need be.
delta, Corey? I'm going to call up Corey Travis, our budget guru.
And it's fine to follow offline. I know we're tight for time, so.
I didn't catch the question, I'm sorry.
So there's a total of 1.9 million proposed in additional. What is that compared to what the base cost?
Oh, so I don't have all of the totals for the existing contracts, but the increases that were included in the FY25 proposed budget are the delta between what we have now and what we expect to need after we complete the RFP processes.
Yeah.
Okay,
Yeah, we
great.
don't
We can
have,
take that
but
as
we
a-
can get you the information of
as a
where we're
follow-up.
at now.
And then, separate question while I have the microphone, for the school clinicians, completely anecdotally, reported by teenagers, so asterisk. It's the teenagers' understanding that while the services are confidential, that if there's any mention of alcohol or drugs, it sort of flips into mandated reporter, and parents have to be contacted. Don't have to answer it now, but just to share that perception and possibly reality is there and is perceived as a barrier as we continue to
I don't
move.
know the
We'll
answer.
take that back.
Sounds good.
Yeah.
Thank you for the presentation and all the work. Do we have a sense of the number of vacancies out of 803 or 4?
Yes, I do. Just so happens, I have a handy-dandy vacancy report.
Sorry to ask.
Hold on a second. There it is.
I think she actually welcomes the question, is my guess, but.
Okay, so we're actually really fortunate. Our vacancy rate right now is 9%. So I don't know what that means. I think we have 77 open positions. Of those, 63 are under recruitment. The ones that take the longest for hiring are behavioral health emergency clinicians. Those can take definitely over a year. And Spanish-speaking behavioral health therapists of any kind, but particularly those who are for children and families.
Great. Well, thank you for the work to try and fill vacancies. I feel like it was higher, maybe double, but I don't remember from last year.
It was 10% last year, I think, right?
Okay.
Wasn't it, Corey? 10% last year for vacancies? Yeah, about that. We went down a little bit, 9%.
So I'm definitely going to want to follow up. I followed the conversation on the Fairfax and both retention and recruitment. I think we need to be willing to invest there. And certainly you think about the different things we've invested in. You can't just abstractly say, invest in this and not put some resources, additional resources in my view. So I'll also want to follow up on the SEPTA letter and the question of I'm aligned if it's not serving empathy for sure for those behavioral health issues with kids that are, I've seen kids of all types need help, but there's a difference in my view in terms of scarce resources when they're low income. So I'll want to follow up just a little to understand that, but thanks for all the work.
Okay, thank you. Takas, you had one more question.
It's more of a suggestion. So scanning the advocacy that we have received and interacting with groups and constituents, I found that there is an emerging need, and I was motivated by your account on the dentist position that now retires. There is another part of health services that I find that are dearly needed right now, and the need is exponential. It's a specific geriatric health. So people with macular degeneration, for example, with these ailments that come with increased age, I find that more of these residents have no recourse, and they don't have the first place to go, despite the fact that they're covered by Medicare. So I have heard more than I ever expected that there is an emerging need there, and I just invite you to think about that.
Thank you. A question from our Disability Commission on the survey. Do we survey? I know we do customer satisfaction surveys. Do we do a survey of our disability community to sort of find out what's...
Survey of disability community.
Do we do it?
Maimouna? We do it. We have...
Anita, I can answer that. We do an annual survey in June of every year for developmental disabilities.
That's LaVoice Reed.
Yeah.
Right, but that only, this is Elizabeth Priot, that only covers developmental disabilities, which is, of course, important, but it doesn't capture the entire disability community. As far as the commission knows, there was at one point, several years back, a requirement that a survey be done every 3 years, but that was discontinued.
Thank you. Anyway, I'd be interested in more not maybe here now, but more, and thank you. I mean, thank you very much. Mm-hmm. Yeah,
Well,
I think it may be.
We'll take that back and we'll talk with our
it might be a
partners
different
in the
office
Office of
handling
Human
it.
Rights too.
Yeah,
That might
right.
be.
We will check on that, but she's absolutely correct. I mean, it's very different. People have different issues that they need to deal with. Thank you. All right, I think we're ready to move to housing.
Yes.
We're ready to move to housing. All right, Mark, Ms. Schwartz, do you have a introduction?
Yeah, so I think, Anita, you are staying here, and I think Ann Venezia is going to come up.
I just want to alert you that we have two more sessions. We have the housing, and then we have CPHD.
Yeah, I'm aware. We've actually added a little on time. I'm trying to be.
We switched it. I got the opportunity to go first, but I don't want to shortchange my colleagues.
We'll just go longer.
Well, and while we're switching, I'll just go on the record that I really think these need to be spaced out into more work sessions in the future. DHS alone is almost 20% of our budget and should really warrant close attention. And we know that CPHD, including beyond housing, warrants a lot of attention.
Happy to accommodate anything you think will work better, for sure.
Yep. No, I think I think it's a good point.
So here we are, and I'm up first for housing, but we have a joint presentation because we have done that historically for I don't know how many years, and because we also believe that housing stability involves multiple components. Some of them are housed in CPHD and some of them are housed in DHS. And of course, we know that CPHD develops the pipeline of affordable units. They put together the funding. They're ambitious in growing the number of CAFs in the county, and you'll hear more about that. But we can't really house people stably in the affordable units without a rental subsidy and the supportive services that are needed for those who have disabilities or other tenancy challenges. And that's in our budget too. So I'm going to try and go swiftly in this. And part of it is, next slide, part of it is that we have a housing grant study, but I don't want to drone on too much about that because you've already had briefings.
No, that's fine. We do need to keep moving, and people will ask questions if they need to.
Housing grants, here we go. So we are still growing. And, you know, since the AHIF funds CAFs are targeted largely to 50 to 60% of AMI, our households largely have incomes at 30% of AMI. So we fill the gap with a housing grant. The proposed budget is for $15 million for fiscal year 25. That is ongoing money, and I'm very grateful to the manager for ensuring that this is ongoing and not one-time supplemental, because we need to have the security that this funding will continue for this critical program. We're reaching 1,642 households in FY25. This is now surpassing the number of households served by the Housing Choice Voucher Program, the federal program. And the monthly grant is $760 on average. Caseloads, again, increased by 19% over the last 4 years. 97% of housing grants participants live in CAFs. Next slide. Oh, by the way, you also have two supplemental documents that came to you electronically, which I will point out in case you need more detail. One is a green one. This is a snapshot in January 2024 of who the participants are, incomes, demographics, et cetera. This is what we call the orange one, which is a history of the Housing Grants Program with all the funding, changes, expenditures, participation. Getting back to this graph, we have blue represents 65 and plus households, you know, in 65 years and older. You realize we have 3 categories of types of people who, if they meet the income eligibility and the other paperwork that's required, as well as having a lease in their name, they have to be either 65 and older, permanently disabled, or enrolled with our CSB, or a working family with children under the age of 18. Blue is the older adults, orange is the disabled, gray is the working families. You can see the breakdown there. The ones that's growing steadily are the 65 and older. Not surprising, because the population is aging. And we're going to be, the average family, the working families, do not stay on this program for a long period of time. They're typically on for 5 years, and then they move on to some other kind of housing arrangement. Next slide. Maximum allowable rents. Well, for 10 years prior to 2020, county manager, we were flat. People could no longer really use the housing grants because the maximum rent hadn't been adjusted. But in 2020, the county manager approved this. So every year, we increased the maximum allowable rent to match the 60% of area median income, so that folks can find units that are, within the rent maximum. So there you see, in this coming year, the 3 bedrooms are really going up, 2,351. Next slide. We embarked upon a housing grant study. We did this all in-house, by the way. No consulting, well, we did have a consulting company for engagement. misspoke. But it was led by our brilliant staff in the Housing Assistance Bureau and Caitlin Hutchinson and Brooke Hammond Paris. And we were instructed to study how the program is configured, and then provide potential recommendations on how it can be improved. So we did basically, since August 2022, we put together stakeholder groups, telephone surveys, collected data, and wrote up what the recommendations were. We presented those to you back in December, so I'll just briefly go over them now. Go ahead, next slide. There are 17 possible enhancements that are recommended. Mind you, this is a multi-year plan. Doesn't mean we have to do all 17 immediately. There's 4 different categories of recommendations. There's eligibility, staffing levels, program requirements, and program operations. In the proposed budget, you will see that 3 of the recommendations are adopted. The first being a change to eligibility criteria, where we are going to pilot housing for transition age youth who are in our homeless services system and youth aging out of foster care. 12 of them, that's the number we came up with, which is based on data that we had, for a period of 36 months. So that's the time frame in which, between transitioning from youth to adulthood, where people end up homeless. So we're piloting that. We also were granted 2 additional housing grant specialist FTEs. So thank you to the manager. And we are also going to be, I'll talk a bit in a minute about our adoption of a different calculation to replace the work hour requirements. Okay, we have additional recommendations that were made for eligibility because of redetermining whether or not we can serve undocumented households with housing grants. The county attorney reconsidered that and did come out with a favorable judgment. So one of the recommendations for consideration is whether or not to provide the funding to undocumented residents, if they're part of an existing housing grants household, because we have mixed status households and we prorate the grant, or B, the entire household composed of undocumented individuals. We have numbers for that we can consider, on a different time. One of the other recommendations was, can we and should we provide housing grants to people who have serious mental illness or chronic substance abuse under the age of 65 if they're not enrolled in CSB programs? Right now they have to be enrolled in CSB programs. This would be a new type of situation where we'd have to sort of put in a lot of administrative procedures and to track that. Staffing level, I talked to you, how HR Human Resources helped us reclassify the positions. And if we go along, if we further pursue more recommendations, we'd like to include a new senior level specialist or a new housing grants navigator, but that's not currently in the budget. Next slide. 8 recommendations in program requirements. I can't go into all this. This is a lot of stuff. Replacing work hour requirements with minimum earned income. Rather than getting people's pay stubs, how many hours did you work, we've basically come up with a formula of if you make $300 a week at minimum wage, that means you're working 25 hours. So it's an easier form of calculating, no financial impact. Aligning MARS with 60% AMI, we already have them aligned, but it's a year behind, it lags, because the MAR come out in April, we don't get it implemented until the following fiscal year. Inspections for non-CAF units, already happening. CPHD, 20% of all CAFs are inspected each year. But we have housing grants units that are not in CAFs. So this is to ensure that if people need inspections, it is available. Decreasing client rent responsibility. Well, housing grants participants contribute about 40% of their household income. This would reduce it to 35%. Increasing flexibility for working families with disabled dependents so that the income of the disabled dependent is not part of the calculation of the household, and allows then for the family member to have more time to take care of the disabled adult. Aligning limits to 50% AMI. Right now, our income limit is set at 85% of 50%. Don't ask me why, but that's the way it is. Excluding $20,000 for income for children who are full-time students. So if you're pursuing, if you're 18 to 26 and a student, your income up to $20,000 would not be part of the household income. And a utility deduction of $100 per household per month. HCV has a utility deduction, Housing Grants doesn't. Okay, also we need to change, whatever we do, we're gonna have to change our electronic record because our system, Yardi, needs to always be updated when we have new changes. And we're trying to train staff and provide more materials that are user-friendly in multiple languages and doing more outreach. That's it for housing grants. Oh, the report is online. Thank you, Mark.
So people can go and read it.
Yes, the report is online, and it was translated into Spanish. And we're having open houses in English and Spanish, and our staff has been presenting to the multiple commissions, Housing Commission, Tenant Landlord Commission, CSB, there's a bunch of different commissions. Next, am I going fast enough? Housing Choice Voucher. Housing Choice Voucher, you know, all federal money. And we have now up to $24.4 million, 1,570 vouchers being used, and 99% in CAFs. We really love those CAFs. Next, the wait list. The wait list was opened after 11 years being closed, and we did it all electronically. Last time we did that, Corey Travis had to sit in Kenmore Middle School with a line around the block. But now it was online, and we then, out of that 19,000, did a lottery, pulled out 5,000. Those are ranked according to the priority categories, which you can see up there. And as vacancies occur, we will be pulling people off the wait list. Next slide. Permanent supportive housing. Permanent supportive housing, you know, provides rent and supportive services. Our local funding is kind of capped at 3.6 million in the local budget. In fact, it went down a little bit, but the big growth is in the state-funded subsidies. That's up to $1.2 million. No, that's increased by, yes, up to $1.2 million. So the good thing about the state money, although you have to meet certain diagnoses and criteria, they have a better ratio of staff to clients, 1 to 30. On our local side, of course, as the theme has been, we do not increase the staff as we should have. Okay, next. Homelessness. Well, I have 3 board members here who participated in the point in time count in January in the cold in the evening. It was great. The numbers are going up. We don't have the 2024 data yet, so I knew that Takas would say, where's the 2024 data? But this is 2023. You can see every area has gone up. And in fact, what Walter Way said about the adults is true. Percentage-wise, it's not as much an increase, but there were 25, no, how many? Wait a minute, that number's wrong. Oh, yeah. Look at how many older adults increased.
It says 42, I think.
Yeah, 25 additional. So this is concerning. We have more pressure. We're trying to find some places for the older adults. They can't be put into the regular shelter. Just doesn't jive. the adult, a regular adult population where the seniors or older adults, they have much more complex needs, medical needs. And there's also there's something between housing independently and nursing home. And they end up being homeless, and then how do we support them? So that's that. Eviction prevention? One more? Woo! Eviction prevention. Okay, sorry, I'm getting a little giddy here.
What's in the water bottle?
We did, look at this. We spent millions and millions and millions of dollars. You all should feel very good about the amount of people you helped prevent from being unhoused and evicted during the pandemic. And then we thought, oh, it's going to go away. The problem will go away. No, it did not go away because of the inaffordability of the housing. And when the state stopped funding in September 2023, they had made commitments to people for their rent arrearages. So Arlington to the rescue, and we spent a lot of money. Now we've put a cap, $3,000 per household per year. They have to provide proof. We hope it's going to settle down. We did manager added 2.0 FTEs for us to manage this because it's also been managed with temps. And there's $2.3 million in ongoing funding. That is the end of my part, so that I can turn it over to Ann, who's got her part.
Try it again. Yeah, got it.
Okay.
Yeah.
All right. Thanks, Anita, and good afternoon, everyone. I'm Ann Venezia. I'm the Housing Director in CPHD. So as Anita shared earlier, her love of CAFs, so Committed Affordable Units, or CAFs, provide a really important supply of rental homes for our DHS clients. So the primary goal of the county's Affordable Housing Investment Fund program is to create and preserve CAFs for low-income families in Arlington, including DHS clients. The county is a mission-driven lender, and AHIF is the county's main vehicle to both preserve and create long-term affordable housing by making low-interest loans to our developers. With Arlington's AHIF program, the county historically has decided to use these funds as what we call cash flow loans, meaning the county is repaid as property funds are available. Since AHIF's inception in 1988, the county board has allocated approximately $600 million for over 125 loans to date, and the most significant of these being a $150 million loan to help preserve the Barcroft community in 2021. With this loan model, since the inception of the program, the county has received approximately $160 million in loan repayments, and 42% of the county's loans have paid in full. For fiscal year 2025, the county manager proposes $20.5 million for the AHIF program, and that includes $9.7 million in ongoing local, $10 million in one-time local funds, and $800,000 in federal home funds. This is approximately $5 million more than what the county board adopted for these sources in fiscal year 24. So next slide. With the AHIF model, we've had a number of accomplishments these last few years. For example, the county's CAF portfolio grew 30% between fiscal year 20 and fiscal year 23, from 8,650 units to over 11,000 units. And during the same time period, the number of CAFs affordable to households earning less than 30% of the area median income more than doubled. Because of the board's commitment to AHIF, 12% of the county's rental housing stock is now affordable to households under 60% of the AMI, and almost half of all CAF properties are provided to family-sized households, which provides stability to these low-income families, so thank you. Additionally, to improve oversight of the county's investment, CPHD Housing increased CAF inspections, as Anita mentioned earlier, from 5% of the portfolio to almost 20%. And this is even with the portfolio growth that I mentioned a moment ago. And that is over about a 3-year period. And most of the accomplishments that I just mentioned on this slide occurred during a national pandemic. So just to remind everyone of that. So next slide. The majority of CAFs in our inventory are the result of county financing, and the remainder are the result of site plan and other land use tools. While the majority of the county's CAFs are affordable in the 30 to 60% of area median income range, we do also have some CAFs affordable at 80% of AMI. Between fiscal year 19 and fiscal year 23, the county has produced an average of 532 committed affordable units annually as a direct result of county financing. Through the acquisition, renovation, and new construction of CAF units, the county is able to provide safe and stable housing for almost 12,000 low and moderate income households. $20.5 million proposed for fiscal year 25 for the AF program may be used to further support CAF production on new and existing projects. Next slide. So I also wanted to take a moment to highlight some of the operational support we've received to further the county's long-term strategies for improved oversight and tenant support at aging CAF properties. And that report was released in April 2022. We shared a one-year report on these strategies last spring, and annual progress will be shared on the Affordable Housing Dashboard in future years. So what are some of the things that we've been doing? So the county has over 50 properties as part of our multifamily loan portfolio. And given Arlington County relies on housing providers to own and operate this affordable housing, staff works closely with property management and owners to monitor the health of these CAF properties through physical and financial inspections, as well as compliance reviews. Through the fiscal year 23 and fiscal year 24 budget process, resources were provided by the county board at the recommendation of the manager to increase property inspections capacity. And as a result, CPHD Housing has contracted with a third-party inspections firm, and capacity has increased sixfold since fiscal year 21. So this is a pretty big accomplishment. Additionally, CPHD Housing received a new FTE during this time period to provide overall CAF resident and owner support. This FTE provides additional compliance capacity, which has increased our ability to attend resident council and tenant meetings, follow up on maintenance requests, provide greater technical assistance for income certifications, and support other property operations for our affordable housing providers. So the county manager's fiscal year 25 proposed budget includes continued support for these functions with $150 million, let me backtrack, $150,000, see Mark's leaving the room, $150,000 in ongoing general funds.
Just seeing if we're paying attention.
$150 million, okay. Next slide. As we anticipate our full funding picture for fiscal year 25, it's important to consider the county's commitment to the Barcroft community. As you may recall, the county assisted Jair Lynch by providing a $150 million loan, which was funded by a county line of credit to support the purchase of Barcroft Apartments back in 2021. And it consists of 1,335 units, and it's home for over 1,100 households. So far in fiscal year 2024, the county board has approved 2 renovation use permits, as well as a site-wide financing and affordability plan. Staff is working now with the Jair Lynch team, as well as Barcroft residents and the community, to review the proposed land use aspects of Jair Lynch's master financing and development plan. While higher interest rates and increased construction costs have made the financial models more challenging, the financing and affordability plan approved by the board in December 2023 exceeded commitments made to residents in 2021 by including a rent stabilization plan and deeper long-term affordability. Also in fiscal year 24, the county board approved using $15 million in closeout funds to pay down principal on the county line of credit, which was used to fund this $150 million loan to Jair Lynch. A significant part of the county manager's proposed budget for fiscal year 25 is using an additional $15 million in one-time funds to further pay down line of credit principal. If included in the adopted budget for fiscal year 25, the additional principal payment may reduce debt service paid by AHEF by approximately $1 million annually. We also continue to work with Jair Lynch to capture savings on future tax credit phases at Barcroft that could further reduce line of credit principal, and county staff is also reviewing future refinance opportunities for the county debt that could reduce the interest rate and therefore annual debt service. Next and final slide. This slide summarizes all of the funding pieces associated with AHEF and our development projects for the board's consideration. The county board's annual appropriations to AHEF is one piece of the county's multifamily development loan fund. This slide shows how developer contributions, loan repayments, federal funds, and the Columbia Pike TIF also support the county's loan fund for multifamily development. With all of these sources for fiscal year 25, the projected county budget is $47.7 million. This slide also shows anticipated debt service payments for both Barcroft and Buckingham Villages 3, which are $7.4 million and $2 million respectively. If we add the proposed principal payment to the county's line of credit for the Barcroft loan, the total is $24.4 million. In light of these debt service payments, the proposed net budget for AF is approximately $23.3 million in fiscal year 25. These funds, along with anticipated carryover balances, will help support future phases of the county's Crystal House project, as well as potential preservation needs in the existing CAF portfolio. This concludes our presentation, and we're happy to answer questions.
Thank you. I think we'll take our commissions next, and then we'll see if there are questions. Thank you. I think I saw Mr. Macbeth. Kellen, are you here? Come on up. Chair of our Housing Commission. And David Tim, he may be virtually. Yeah. You're on. Go ahead.
Thank you. First off, I just want to say thank you to the county manager and staff for the increases in the housing budget this year, particularly the housing grants up to $15 million. And it's also my understanding that this is the 50th year anniversary of the housing grant program. So happy birthday to housing grants. Also appreciate the ongoing funding for the CAF inspections. So thank you for honoring the commitment that the county made to the Serrano residents and residents of all of our CAF properties. And appreciate the increases in funding for AHIF this year. The Housing Commission is still concerned about the overall funding for AHIF, even with the increase up to $20 million. And we'd like the board to consider increasing that to $30 million because what we need to actually meet the Affordable Housing Master Plan goals is somewhere between $40 to $50 million a year. And the $20 million is already spoken for between the Barcroft debt service as well as Crystal Houses and other projects that the county has already committed to. So if we're looking for new projects that may be coming up, right now, none of the $20 million that's proposed this year will be available for that. We also would like to see additional support and resources to help implement the long-term strategies for CAF properties that Ms. Venecia had mentioned. I know for a couple years now, we've talked about including a deputy director position for CPHD. We think that's still needed to increase staff's capacity to follow through on a lot of the wonderful plans that have been adopted and put in place, but don't always have the capacity of sort of already overburdened staff to take on new things that benefit our community. As part of that, we'd really like to see increased funding for support for formation and support of resident councils at CAF properties. This is something that was included in both the Housing Commission and Tenant Landlord Commission's recommendations, as well as the staff report. And it's fantastic that Barcroft now has a resident council and that staff and Bugada have been supporting that. We'd love to see that at other CAF properties so tenants are empowered to have a voice and make sure that they have a say in what's happening in their apartments. We would also like to see additional funding and adequate funding for implementation of the Regional Fair Housing Plan that was approved by the board last year. I know the Disability Commission also mentioned some of the concerns around additional need for fair housing. One of the things that we'd like to see is funding for the Office of Human Rights to do expanded fair housing testing. We weren't able to figure out what part of the Office of Human Rights budget is dedicated to fair housing. It'd be great in the future to have them included in this session and have the fair housing support be part of the overall housing budget. But that's something that was part of the plan adopted by the board last year to do more regular testing and expanded testing. We haven't had fair housing testing at Arlington since 2019, so it's been a while. And we would also like to see additional support for the Office of Human Rights to expand enforcement on source of funds protection, which we're very excited to see is on the board agenda for this Saturday. So thank you for that. But we've heard reports from the continuum of care community that our housing choice voucher recipients are losing their vouchers because landlords are not renting to them. which is illegal under state law and hopefully soon to be illegal under Arlington County Code. But we really would like to see some stepped up enforcement to ensure that all of our residents, low-income residents who receive vouchers, either from the federal government or Arlington housing grants, they have the protection to be able to use those at any property in Arlington. We would also, I think echoing what was brought up by DHS, would like to see enhancements to the housing grant IT system, so Yardi, the client management system. We've heard repeated struggles with adding new functionality to implement some of the changes and advancements that they would like to see with that program. And then we would also like to see additional funding, or at least what resources will be required for the full implementation of the county's strategic plan to functionally end homelessness in the next 4 years, which is a fantastic and ambitious goal. But the Housing Commission is concerned that without additional funding for things like short-term rental subsidies, for rapid rehousing, for supportive services and resources to attract and retain case managers, to do the work, working with our unhoused population, that we're not going to be able to meet that goal in the next 4 years. And then we would also like to see continued focus on equity analysis in our housing and planning work. That's something that I think the county has started doing a really good job of incorporating that into our housing policy programs and some of our planning decisions as well. We'd like to see that go further and have more resources to allow us to do more analysis and understanding of who's impacted, who's left out, who was consulted, who wasn't, for some of our very key decisions. And then lastly, and I know it didn't come up yet, but as part of the CPHD budget, our understanding is that the proposal is to cut 2 planners from the planning division. We definitely have concerns about cutting those positions, particularly because looking at the work plan for the planning division right now, it does not include revisiting the East Falls Church area plan, which I know was called for as part of the Plan Lakes and Boulevard adoption, as well as looking at the affordable housing ordinance and the enabling legislation to come up with recommendations to get a better deal for Arlington residents when we're doing site plans in the future. So we definitely think that it's important to have enough resources on the planning side to ensure that important things like that can move forward. Thank you.
Thank you. Thank you very much. And that brings us to, I think, David Tim, if not here, perhaps online.
I am here.
Great.
Can you hear me okay?
We can hear you just fine. Thank you. Go ahead.
Thank you. Well, good afternoon. My name is David Tim. I am the chair of the Tenant Landlord Commission. I would like to start off by thanking you all for taking this time to invite commissions such as TLC and Housing and others to provide comments on the budget. It's always important for us to be involved in these processes because oftentimes I think we can see where the gaps are in the budget and help draw attention to that as decisions are being made. In terms of the things that TLC has discussed as being particularly important, I wanted to put one up front and then discuss a couple others as well. But primarily in our discussion at TLC's last meeting, we were very focused on the CAF inspections. This is a new program that has been it's been increasing inspections through contracting out to a third-party vendor, and it's our understanding that these inspections take place on approximately 10% of the CAF units per year. This is a line item in the budget that is a mere $150,000. And we think that it has a lot of effectiveness in making sure that those who are in CAF units are receiving adequate resources and having good housing in Arlington. The issue in our view is that while it's fantastic that this is a newer program over the last couple of years, and there has been a significant amount of funding coming to it, it simply isn't doing enough. For our understanding is that this means that functionally each CAF unit is being inspected on the order of once every 10 years. And given the amount of dollars that are committed to the program, which is very insubstantial, considering even just housing related costs, moving that to an inspection period that that merely doubles the amount of money to $300,000 could reduce the inspection times to once every 5 years, which would be much more in line with the county's goals of making sure that CAFs are a priority. Second, I would like to just briefly talk about the improvements that Arlington County plans to make on its internal systems. We have a subcommittee at TLC right now that's very focused on the problem of information sharing or lack thereof on statistics that are collected by various parts. And we intend to issue a recommendation on that by the end of the year. But in the meantime, we ask that some funds be reserved, as housing indicated, related to these internal systems so that they are available if and when the time comes that these systems can be integrated together so that we get actionable statistics for use across all of the housing programs. Third, we would like to echo Housing Commission's request for adequate funding on long-term strategies for CAFs. In addition, we would ask that adequate funding be allotted related to publicizing TLC, Housing Commission, and other resources for renters and landlords. And my last two items are just echoing the requests made by Housing Commission on regional fair housing and source of funds. Again, we want to acknowledge how Arlington County has treated housing in general, particularly through the pandemic, eviction services, and the attempts to end homelessness very seriously. I want to again acknowledge the fact that 8% of the budget is going towards housing in general, and I think that is a testament to Arlington prioritizing its residents, many of which are at the renter population. So thank you very much, and I look forward to your comments.
Thank you, Mr. Tim. All right, colleagues, I think we are to questions about housing. Who would like to go first? Ms. Coffey.
So I tried to jump ahead anyway.
Yeah, go for it, Maureen.
Yeah, so on eviction prevention, we've seen this continually increasing need, and now we have the stoppage of the federal funds, and I'm so glad that we found a way to put local ongoing dollars into this. I think it is genuinely one of the most important things we can do. From a prevention paradigm, the amount we would spend after the fact to respond to the crisis of eviction is hard to calculate. And so doing it up front is really important. But at the same time, we're not able to put as much in as our federal dollars had been. Do we think over time the need is going to continue to increase from what we're even seeing this current year? And at the funding level that we have, to what extent are we really able to respond to the existing need?
Well, you can have the Anita Friedman interpretation or the, housing in Arlington is basically astronomical, as you all know. Wages have not kept up. From a common sense perspective, that equals people not being able to stay here, you know. With renters, you know, particularly low-income households, there's the need is exacerbated by other kinds of circumstances. And so I think you could put any amount of money into the eviction prevention and we would use all of it. But we also realized that during the, you know, we were very sort of as flexible as possible with our regulations during COVID. But, you know, there should be some parameters around who qualifies and who doesn't qualify, not based on documentation or status, but whether or not you're able to provide proof that you are facing eviction. We also, you know, do try and, there are other reasons for eviction that are not just financial related, and those are happening too. We go to the eviction docket, we try and, you know, present the case for the, for having the evictions dismissed, but I think you could put any amount in there, and Brooke probably agrees with me, that, but I think that, you know, there are choices to make, right? You know, in a place like Arlington with such significant housing costs, you know, you can put it in prevention kinds of things and eviction prevention. You can put it in homeless services because you're going to always have homeless, or you can put it in housing grants where probably you will obtain the most stability for people who want to stay in Arlington on an ongoing basis. It's a policy decision for the board.
Yeah, I think that is a good transition to my second question, which is kind of, can you describe a little bit how we interact our housing, the financial side of our housing services with the wraparound and other supports, knowing that housing instability and economic instability can be some of the greatest triggers for other, you know, behavioral health, substance use, and other issues as well. So what is kind of the interaction that we see between those?
Well, we have also within the, you know, the front door that I was showing you before, the customer service center, we have a whole body of people, social workers and also public assistance benefit people who are all devoted to the front door, basically, to, you know, assess people basically on what needs they're presenting, but then dig deeper as to what may be contributing to the situation. People come in for one thing, they have, you know, a gap in their rent. Then you talk to them, you find out they also don't have childcare, they lost their job, and they have, you know, they're facing a child with mental illness or something. So we do have an internal, pretty robust internal referral system, and we have electronic tools to facilitate that, and we train people. And so then we do, you know, some integrated case management when it's needed, and that's how we basically, you know, there should be basically no wrong door. If you come in one place, you get referred to the other place.
Yeah, I'm so glad to hear that. I'll defer to.
Okay, thank you. Matt, Mr. DeFranti, go ahead.
Thank you, Madam Chair. The first issue I hadn't come into this meeting is with awareness, and I kind of knew abstractly about the doorway shift, but the 22 beds seems like the issue that, given homelessness increasing, that's the issue that like stands out to me is, and so I don't know, my impression is that the Homeless Services Center has been at 49 out of 50. It's been basically full, and so can you help me understand a little bit, don't we have a need for those 22 beds, and how does that, and I'm just trying to calibrate that need vis-a-vis our important medium to long-term investment in Barcroft, but senior homelessness and homelessness in general seems like it stands up to me a little bit as a.
It is, and we are, you know, we are talking to Department of Environmental Services about, you know, potential places where we could expand, you know, some use of some unused facility to house temporarily more folks who are homeless coming into the homeless system. We do basically house a lot of families now in emergency lodging in hotels, motels. Right, Brooke? And, you know, they can stay there for a while until we can basically find, you know, pay for arrearages, get their kids, you know, whatever they need, and then use rapid rehousing to put them into a unit when there are units available. So it's not a good situation, and I can't say we have the silver bullet, but
Sure, so I'd just be interested in following up to understand.
yeah.
I'm mindful
Do you
of,
wanna come up?
yeah, I'd love to hear a little bit more. I'm mindful that safety is a concern that's been raised, at least as I've been listening in hotels, you know, because it's not easy.
Yeah.
But at the same time, you know, there's,
Fine.
is there a most cost-effective way? The mayor of Denver bought a hotel, and
Yeah, sometimes we thought about buying the Days Inn on Columbia Pike.
Yeah.
question.
So one thing that I'm currently working on, I just don't have all the data yet, but my team and I, so we have something forthcoming. We're trying to look at the cost effectiveness of shelter, like how much does it serve to, you know, how much does it cost to serve one household or one person in shelter versus in our hotels, which we know is not cost effective,
Yep.
versus injecting more money in eviction prevention. And so one of the things with eviction prevention is we have that 3,000 cap per household, but I am able to make exceptions to that. So I hadn't been, but because our shelters have been full, and because we know Doorways is going offline, and we don't want to see, you know, families and children sleeping on the streets, we have been making exceptions to the 3K, to Anita's point, to pay down arrearages so that we can either get somebody transitioned out of shelter to free up space in shelter for somebody else to come in, or so that we can help the people that are in the hotels pay off their rent arrearages, which is, you know, hurting their chances to be able to find a place to move to, right? And so we will soon hopefully have that cost analysis so that hopefully you guys can make a better decision, a more informed decision around where are we going to get the best bang for our buck. And right now, yes, we have had some families in hotels for 4 months. So you can imagine a suite type hotel at the nightly rate for one household for 4 months straight. It's not ideal. And so, but this is what we've been having to do because we don't have enough shelter capacity. But also one thing COVID has taught us is maybe shelters in the traditional sense isn't the best model. And so that's why in the RFP, we've baked in options for providers to provide us with options for possible scattered site options. Because, you know, yes.
Deal either.
Yeah.
Yeah, so that's super helpful. I will request a meeting that would be through, you know, mentioning Michelle, and then I don't know if it's you, Brooke, or Ann, or who needs to be in the meeting. I'll probably also seek a separate meeting to understand the facial expression of the manager with respect to the Days Inn. Scattered site on replacement until we had required tenant relocation plans historically nationally meant less affordable housing. And that is less homeless shelter, and that's not going to work. And I don't see how I can justify voting for 15 million on Barcroft and not thinking about this. And so that's an uncomfortable thing to say, sorry, but it stands out. So I'll yield because I've said enough for now.
All right, fine. Ms. Cunningham, Susan.
Okay, so riffing on that a little bit, it does feel like CAFs are not the only answer, CAFs and shelters. And so what creativity have we already applied or might we apply this year to access more units, essentially, whether it's I think we have like virtually 100% overlap of our housing grant participants and our housing choice voucher participants in CAFs. And there's also some overlap with the eviction prevention dollars. What do we need to do to support private landlords being willing to take vouchers? It's back to the source of funds discrimination, but it's more than that. And or truly invest in a network of scattered sites that helps distribute, especially for families, especially for large families, and especially for intergenerational families, cost efficiently distribute them into our neighborhoods.
You want to go?
I can start, and then Anita will fill in with the right answers there. But just to start, one of the reasons that CAFs serve as such a helpful supply of units for our DHS clients is just because of their rent levels. And so I think one of the challenges, and not to speak for Anita and her staff, but for DHS clients trying to secure units in the private market is that it's more expensive to do that. And so CAFs really do provide that really helpful supply because the rent levels are already at the 30, 40, 50, 60% of AMI level. And so I would say that is one of the main reasons. So it's not, in part it's by design, but also too, it's just the practicality of how to make things like housing grants go further. And one of the ways to do that is by renting out community affordable units. So I don't know if you want to.
No, I think you're exactly right. The marks basically almost disappeared, right? I mean, you have the data of when we saw that, remember that declining graph from, from 2000 to 2020 or something? It's like exponential decline. So we're left with the CAFs. Well, it's very expensive to build a unit at 30% of AMI. That's why we mainly build them at 50 and 60%, right? According to my limited knowledge. And so, therein lies the housing grant. If you had more units at 30% AMI, you'd have probably less in housing grants. I mean, as we develop projects, we have to be creative to figure out with the nonprofit developers what kinds of options are there for putting aside certain kinds of, scattered site places for people who are entering homelessness or something like that, just like another kind of community benefit, But there are all these competing needs, So it depends.
Similarly, can I ask, our housing grants today require a full lease of a full dwelling unit. Is there any flexibility to consider shared housing or capital grants out of AHIF to enable, say, a mother-in-law suite to be converted to an official dwelling unit? How does that work?
Yeah, right now we have, one lease per household. I mean, we've never had multiple households in one lease. I'm not opposed to exploring it. It just hasn't been a practice, and you'd have to have willing participants, of course, for multiple households to share apartments.
Thank you. So. Yeah, sorry, the second half of that. So let me repeat it because it was a complicated question before, and now it's a few minutes ago. The question was, with the housing grants, could we transport them into a shared use, particularly for elders, right? If you've got 4 elderly people, could we put them in one house versus 4 different apartments? Corollary to that is if you've already got an elderly couple in a basement apartment, for instance, but it's not really a legal ADU, would we put AHIF dollars in to make it a legal ADU? How would we do that, right? So if you've got a large single-family house, you've got a multi-generational family, aging 90-year-old immigrant grandparents, how do we get some housing support where they are instead of needing to move them to a CAF that will be more expensive?
Okay, so I'll try to answer this question. So historically, our affordable housing investment fund dollars have gone towards these larger rental multifamily properties. We do have some situations where they have been made available for a homeownership situation. I would say stay tuned for our homeownership study, which is going to be released this spring. I don't want to get out ahead of that. But one of the things that we are exploring and that you will hear more about is how we might potentially bring back our home improvement program, which could potentially be used for modifications as you're suggesting. And so I would say that might be a better fit for that type of program. And for our home improvement program in the past, typically we used federal funds for that. Local also could be used. It's something that we're still trying to figure out what the best funding source might be should the program again be brought back. But again, stay tuned because I think that that's a great question.
Thank you.
All right, Takis.
Thank you, Madam Chair. This is one of the most difficult presentations, and I'm happy that you are on the other side of the table because I know that you care a lot about that and that you've been working through these questions. Big picture question again. We have been observing as a community how the race of AHIF appropriations and housing grants, and we have been questioning what's the better bang for the buck. Now, in addition to that, we have also the eviction prevention money that actually, it's not anymore an emergency help program. This is a permanent support program, and this is the way we are treating that in this budget proposal. And I understand the nuances, and we can talk a lot about, what's the future of that, and, why do we need eviction prevention if our housing grants program should be covering that gap. My problem is this, my question is the following. So we are appropriating for a second time now $15 million for a Barcroft down payment. In this financial environment, I understand the intentionality of that, to be able to refinance with a lower interest burden. What is the alternative? If we were to say, for example, that we invest more in our AHIF and with that we buy more in the 30% or 40% AMI, and therefore we have less of a pressing need for housing grant support, isn't that better than avoiding the interest burden? What of the two investments is a better investment at the end?
Okay, so I'm going to lean on something that Anita said earlier in answer to a separate question, which is, at the end of the day, it's a policy decision. So the county manager's proposal to put $15 million in one-time funds to help with the debt management for the Barcroft line of credit, it's just that, it's managing that debt. When we provided that loan in 2021, we recognized that we would be needing continual county resources to manage that debt in the long term. We are coming up on a time when we will need to fix out that debt into long-term debt. Right now, it's still floating. And the goal is to hopefully have the principal balance as low as possible at that time so that our long-term obligations are as minimal as possible. So to provide $15 million, whatever the amount is, towards that line of credit, it basically is to support that debt management strategy. Now, what are the trade-offs of doing that versus investment in CAFs, housing grants, or any of these other programs that we've talked about today? Again, there are different impacts of all of these programs. CAFs, as we talked about, provide that really important supply for the DHS clients and our other low-income households and families in Arlington. We have increasing need, as shown by our Affordable Housing Master Plan review and the updated needs analysis that was done a couple of years ago for units at that deeper affordability level. And it's one of the reasons we're no longer able to rely on housing grants alone, basically. It's one of the reasons why in December, as part of our financing and affordability plan that we brought forward for Barcroft, that we recommended including 10% of the units, or 134, at 30% of AMI for the long-term strategy for that community. Because we recognize that there's an increasing need to invest not only on the subsidy side, but on the capital side for those more deeply affordable units. Housing grants, as Anita said a few minutes ago, has proven to be a really important strategy to help provide stability for DHS clients and low-income households in Arlington. Can help prevent the need for eviction assistance and things like that. So it really, at the end of the day, is, to give you a non-answer, but a policy call. Industry-wide, experts have debated for decades, do you invest on the subsidy side or do you invest on the capital side? And I think what we've tried to present today is that the two really go together. You really do kind of need investment on both. Because they serve different purposes and they help provide, as a whole package, stability for our low-income families in Arlington. So,
Thank you.
wanna add
I
anything to
am
that?
always mindful that we are talking not about a steady population, we're talking about a growing need. So it's not about spending less dollars in one, being smart and buying some efficiency. It's about serving more people on the less efficient side. So that's my problem. I will follow up with that. Thank you.
No. Mark, did you want to add something or not? Okay. Maureen, one more? All right, I'm gonna start. We gotta finish up and
Okay.
move on. But
Yes, I'll try and be quick. Much of our conversation today is focused on those who are really low income in our community, as it really should. But there's a lot of people who are struggling. I think to your point about the just rapid decrease in market rate affordable, or what we're really considering market rate apartments. And something I'm very conscious of is, while we may not need to provide financial assistance to people who have slightly higher incomes in our community, there are a lot of resources and things about renting that can be hard. There's a huge power asymmetry in terms of when you're looking or when you're currently in a leasing situation. And where do our services live for people who are just looking for information or help or support, guidance, things like our Moderate Income Purchase Assistance Program? There's a lot that we have out there, but I think, even as someone myself who has looked for these resources, I'm not quite clear on where they live and how we market that and we get that to the people who really need them.
So we have actually updated a whole packet of information to help support our renter community over this last year. The target audience has been residents living in our CAF units. However, these resources are available really to all renters. And so through a campaign that we had using one-time funds last summer, we actually did provide this packet of resources to all of our CAF properties. And so it ended up being over 9,000 households that we were able to access with these resources. But additionally, I think we are trying to improve and streamline the resources available online so that those can be made available to more people. And I think that we do probably still have some gaps there, as you've acknowledged, but it is something that we're focused on. Again, our first focus has been on our CAF households, but we really do want to make these resources available to a broader group of renters in Arlington, since renters do represent the majority of Arlingtonians today. So,
thank you for that. I think that's something I would love to see us work on as well. Is not just the super low income folks. Our CAF's so important, but there's a lot of people in Arlington who are struggling, who are not in committed affordable, and who could use our help and support as well.
Oh, absolutely. It's the people caught in the middle of sometimes the hardest time. Mr. DiFranti.
Thank you for putting me on the clock. This won't be a question. It'll be a series of I'm going to be requesting some meetings, housing grants. I don't yet know what we put in and what we didn't. I don't have off the top of my head what we put in and what we didn't put in. I did hear that there was this position. I'm not addicted to additional positions, mindful of scarce resources, but I'll be emailing you and Shannon, and I don't know whether it's both of you or just you, Ann, on housing grants. I'll follow up on that. I want to know what we can and can't do. On permanent supportive housing, I also heard, I'm going to email there, because you want to prevent homelessness. That is a great way to do it, and I think that we reasonably, scarce resources we left out. I think I heard a position, and I want to understand a little bit that, so through the appropriate ways, I'll be asking about that. Those are both investments. On page 794, there's a code enforcement inspection position that's frozen. I want to understand that. I think from the description, I know we're doing a lot that's related to our discussion of the Serrano, and Mr. Macbeth mentioned it. I just want to understand that position, and so okay, sorry about that. And then the last thing I will say is, in this series, I believe, we currently pay folks who have $500,000 and an income above $100,000 a real estate tax relief program. That is not equitable. And if legally we can stop those two subsidies, I believe in the real estate tax relief. There are many low-income homeowners. I used to work for an organization. This is not your fault. It is our fault because we have not taken a step. But if we have the ability to at least cap at $500,000 in, if you have $500,000 in resources in addition to your home, we should not be paying you. We should not be forgiving your real estate taxes. If you have an income of $100,000, that is not average in Arlington. But we can't subsidize. There are 24,000 people who live on $42,000 a year or less. So I will be, if we don't have the legal ability, I am mindful process-wise there is a problem in changing a program that we did a long study on. If we don't have the ability legally to do it right now, if I'm breathing, I will bring it next year because not acceptable on an equity basis for us to be subsidizing folks like that. And it's no one's fault here. It's on us to change.
Thank you, Mr. DiFerenti. Sorry. That's all right. No. Susan.
So I'll put a pin in that one because I think tax deferral and that overall program kind of goes back into that conversation about where's our dollar best spent. And if a family does already have a household, have a home, how can we help them stay in that home and perhaps open it to others so that the dollars work out better? So we'll come back to that. Two questions, which we can also come back to later. They're just take-home questions. But one is we had not adjusted the MAR and sort of the caps on eviction relief with any ongoing formula. So you did a sort of 10-year catch-up on the MAR. We also have this conversation and challenge on our fees and other things across the county. So I wonder, might we build in some inflation adjustment so that that happens naturally and then we can override it if need be? But that would be one question. And then the second is on eviction prevention. I know coming out of the pandemic, it's been a little bit Wild West. How are we doing on actually retaining prior eviction prevention clients in the county? So that can be a follow-up, or you can give a quick heads up.
Okay, we'll bring up Brooke again, because she loves being in the spotlight. I really don't.
But
I do have, though, one piece of information, Matt, that I wanted to share. We did, and yes, it's all a policy decision how to spend the dollars, but the average income of real estate tax relief household is $39,211. So they are not as what we think. The rate, the income thresholds, yes, are extremely high, and that can always be adjusted downward, because we've done that before. Without having to do an entire study, we could.
Super important to make that point because most of it is not there. But I just don't know how I sleep if $100,000 and $500,000.
Yeah. And the MARs, we are keeping up annually with when HUD comes out with them.
Okay.
That was implemented in 2020. And now we're going to do it in time for the budget year that it pertains to.
So before I get to Ms. Cunningham's question, I wanted to just, Nicole Dula is on, and she wanted to correct our mistake.
Yeah.
Basically, we do allow shared households in housing grants.
We do?
They do not have to be related. And so that is something we already do. But anyway, to answer your question, at least somewhat, and we can follow up with more data, we are starting to collect this data. It's been a long time coming, but as you know, it's like you said, the wild, wild west. It's been a huge exponential growth in a program, and we've been scrambling. But we are beginning to collect quarterly data comparing eviction households that end up on an eviction docket and then cross-checking them with households we've been serving to kind of get the best proxy indicator of like what's the effectiveness of putting our money in eviction prevention and our households getting evicted anyway. The last 2 months, and we are going to start publishing this quarterly, but the last 2 months, it was about 25% of households that we helped within that previous year that did end up on an eviction docket. So I don't know what to compare that to, though.
Right, and I think it it might be important to somehow, recognizing the data is hard, but to look back as well, whether it's a survey instrument or something to say, how do we do during these challenging times and what can we learn from it? Because I do think we've all identified that part of the delay in changing the caps let people build arrears that were large, and we're still digging out of that. How do we avoid that in the future? And also, how do we have soft landings for all of those households that may just not be able to stay?
And an additional factor to look at is the documentation status, because we do know during COVID we supported a lot of undocumented folks on an ongoing basis. That's why one of the recommendations is to use housing grants to start a pilot for undocumented. But I don't know if we have the data now of what the status is of people who are in eviction prevention.
Well, it's kind of a don't ask, don't tell. But what I can tell you is, obviously, a majority of the clients accessing eviction prevention are BIPOC. 26%, this is data I just pulled on my phone, 26% are Latinx, and this is this current fiscal year. 61% identify as Black or African American. 72% are females, female heads of households. And so we don't ask for immigration status, but I don't want to throw a number out there. My hunch is around 40% might be undocumented just based on qualitative data that we've been seeing. Most of the households that reach out when there's questions or whatnot, it gets elevated to me, and there are, for the most part, undocumented. So, yeah.
And most of those women have children?
Yes.
Of course. Yeah.
I bet they need
Yep.
childcare.
Anything else, Susan? No? Okay.
More, but another time.
Yep, more for another time. I think I see another work session of some sort, maybe not even a budget work session, but a lot to unpack and talk about. I think we're ready now to move on to our next and final. Thank you so much, ladies. Really appreciate it. Thank you, thank you. That brings us to our Department of Community Planning, Housing, and Development. Let me use the mic. Board members, take your seats, please. Everybody else, calm down. Life happens. It's okay. Mr. Manager, would you like to introduce the next item, the next group?
Yes, we have CPHD here, and I'd like to welcome Samia Bird. Over to you, Samia.
Thank you. Good evening now. My paper says good afternoon, but good evening. We are pleased to share with you the Department of Community Planning, Housing Development proposed FY 2025 budget. So our slide presentation, well, actually, while that's coming up, I will share with you all, we have the 2023 annual development highlights. So a copy for each of you if you would like them.
Yep.
And then if you manage to stay with me through the presentation, you might receive a Lego at the end of this.
You're going to see a lot more of these Legos, okay? That's all I'll tell you.
Oh, fun. So next slide, please. So you are familiar with the acronym CPHD, and I want to start by sharing a little bit about what and who is behind CPHD. We are a multidisciplinary 220-person team whose work encompasses all areas of land use, planning, housing, neighborhood, and community development. We are inspectors, planners, administrators, managers, policy analysts, program and project managers, regulators, code enforcers, preservationists, and more. Next slide, please. Our mission shown here represents a refined mission statement for the department. It was revised last year to embody equity, inclusion, and better reflect the county's vision related to the core purpose of why we do what we do. It expands beyond land, buildings, and structures, which the physical, to include the relationship of our work to people and community. Next slide, please. So we are organized into the 6 divisions represented here, along with the director's office, and I want to thank all of the staff and our leadership team for being here and hanging in there with us this evening. The director's office provides vision, leadership, strategy, and structure under which the department carries out the mission. This includes our community engagement and research and strategic initiatives group. Our business operations division serves our entire department, providing guidance and support for human resources, budget, and IT systems to facilitate the organizational and resource capacity needed to carry out the department's mission. Our housing division ensures a range of housing choices are available and accessible to all, with a focus on policy, housing development and finance, outreach and education, and support for community development services and programs. Inspection Services regulates and enforces the safety of structures for occupancy and use, and ensures buildings are constructed to code for long-term sustainability, efficiency, and the health and welfare of all people. Our Neighborhood Services Division builds community through partnerships, shared history and culture, and the creation of neighborhood places that serve all of Arlington. Our Planning Division facilitates and implements future growth and regulates the build-out of Arlington as a diverse grouping of great places, setting the long-range vision and reviewing developments that effectuate that vision and our mission. And our Zoning Division regulates, monitors, and enforces development and land use to ensure it is orderly and predictable, and to mitigate impacts in compliance with the zoning ordinance and county board approvals. Next slide, please. I'm proud of the accomplishments of the department over the past fiscal year and want to highlight some of them here. And I note that this does not cover the full range of our day-to-day work and operations, but $5.59 million of Arlington Housing Investment Funds allocated, 174 committed affordable units, or CAFs, added to the housing supply through new construction and preservation, 2,000 CAF units inspected across 20 properties, our regional fair housing plan completed with COG, a new affordable housing dashboard, which we launched in the fall of 2023, intended to provide a wide range of information regarding Arlington County's affordable housing efforts. And the dashboard serves as an interactive annual report on progress towards realizing the goals, objectives, and policies of the Affordable Housing Master Plan. And the contents of that dashboard span 20+ topics and include things like housing supply, committed affordable housing demographics and distribution, renter assistance, ending homelessness, affordability, and average median income. We've successfully brought forward for approval 8 site plans and a form-based code use permit project generating $13.65 million in contributions to AHIF, $6.9 million in off-site transportation contributions, $7.35 million in public space as well. A new use permit for the Career Center, successful completion for Plan Langston Boulevard, adoption and implementation of expanded housing option, 3 special glove studies, 2 Arlington neighborhood program projects completed totaling $610,000 in improvements, adoption of the Historic and Cultural Resources Plan, awarded 12 historic preservation grants, more than 6,500 zoning permits reviewed, 176 certificates of occupancy issued for 176 single-family homes, more than 2,250 zoning inspections, 92% customer satisfaction rating based on more than 1,000 customers served in person, 18 online engagements, engagement by more than 9,800 stakeholders, 50 in-person pop-ups, 56 newsletters to 28,000 subscribers. And there's and we can keep going. Next slide, please. I also want to highlight the Permit Arlington Center located on the first floor here in Bosman. With the launch of Permit Arlington and moving our permitting processes online, the Permit Center is one of our efforts toward advancing equity, where technology might present barriers to customers, in addition to supporting those who prefer in-person assistance. The center is staffed by CPHD, DES, and DTS, and is an additional resource to having 24/7 access through the system to permitting. In September of 2023, the system development for permitting was completed. Our attention is now on system maintenance and support and opportunities to expand in-person access to account for the various ways customers may apply for permits or need support with our permitting process. We will be expanding in-person access of the Permit Arlington Center, moving from 2 days to 4 days per week. A few points about the Permit Arlington Center and Permit Arlington system. On average, we see 62 in-person customers per week. Customers experience a 6-minute average wait time with an average of 13 minutes service time. And in addition, close to 23,000 applications were submitted in FY 2024 to date, so that's July 1, 2023 to March 13th, 2024 actually, and less than 3,000 of those required technical support for internal and external customers, which technical support is being defined as fix requests and how do I request, and please undo requests. Next slide, please. The next 2 slides show the goals established for permitting when the Development Fund was created in 2009 and how we have responded and delivered over the past 15 years. There were 5 metrics documented in the County Board report when the fund was adopted. These slides show the level of progress and resulting outcomes for each. There is a challenge in collecting data over time and data inconsistencies and inability to track, measure, and compare because of the change in our systems. But overall, we have found that the Development Fund has met and continues to make progress in meeting the performance metrics initially set forth. So on this slide, you see the first 3 of 5, improving customer satisfaction, the Permit Arlington system, and One-Stop Customer Service Center were established. Reducing permitting and plan review time for interior alterations in our commercial buildings, down from 90 days to 2 with our fast-track permit process. The third, timeliness of construction inspections from between 85% and 95% to now 99% to 100% within 24 hours of being scheduled. Next slide, please. The fourth and fifth, time for application to issuing a permit for new residential from 8 to 10 weeks, now to 10 business day review cycle. And commercial plan review from application to issuing permit, the initial review was within 10 weeks and permit issuance 6 months. That was the goal at the time. It was 6 months then for review and 18 to 24 months for a permit issuance. Now it's a 15 business day plan review. I do want to take a moment to share a little bit more data of the customer experience today with permitting applications, review, and issuance. When we look at our inspection services plan review in FY 2023, there was a 2-day average for first-time plan review for commercial fast-track permitting. a 15-day average for first-time plan review for non-commercial buildings, a 10-day average for first-time plan review for new residential buildings, and a 14-day average to permit issuance for commercial fast-tracked. And I mentioned first-time plan review because many permits may go through multiple iterations of review. Our zoning plan review currently provides an 8-day average commercial by right building permit. 10 days was what we committed to. We committed to 5 days, business days for commercial express building permits. We averaged 2 days. We committed to 21 business days for special exception new construction permits. We averaged 19 days. We committed to 10 business days for special exception alteration permits. We averaged 8 days. We committed to 3 to 5 days for trade permits. We averaged 2 days. We committed to 10 days for residential new construction permits and reviews. We averaged 8 days. We committed to residential additions and alterations, 5 to 10 days. We averaged 6 days. And then on our EHO applications, we committed to 30 days. We averaged 15. We also committed to a 10-day review cycle for sign permits. We averaged 9 days. And we committed to a 10-day review cycle for comprehensive sign plans. We averaged 12 days. Next slide, please. I want to focus a little bit on equity. CPHD's work in alignment with realizing Arlington's commitment to equity, its vision, missions, and goals. Under normalized, what I want to highlight is hosting and supporting the development of the racial history timeline and the race and ethnicity demographic dashboard. The dashboard was updated last month, and both continue to be valuable tools for all staff as well as the community in their use. With respect to organize the work of the department equity team, which we call our Racial Equity Committee, that is beginning based on the results of the recently completed assessment to develop a racial equity action plan. And over the course of the year, we will develop our racial equity action plan not only based in our assessment results, but as a means to implement our department mission statement through the work of each division. And I'm really excited, under Organize, you will see that last bullet there, our participation in 2 COG Gear DMV mini-series, one on racial equity and comprehensive planning, and the other on budgeting. The budgeting one happened last fall, and that is concluded, and we are actually underway with the one for comprehensive planning. And last fall, based on a concept I had to convene land use, housing, and development practitioners first in Arlington, as a member then of COG's Chief Equity Officers Committee, the concept was expanded and open to jurisdictions in the region. We convened a regional group of housing, land use, and development practitioners in November of 2023 to start a conversation on what would it be like if our comprehensive plans, policies, and processes centered equity and racial equity. The result is a set of process and policy-related principles that I am pleased to say today were adopted yesterday by COG for implementation by member jurisdictions. Thank you to Chair Garvey. They are guiding principles.
It was very cool to be there and have you presenting. It really was. I was so proud of us. Yes.
Thank you. They are guiding principles for equitable development intended to be incorporated into comprehensive and other such land use plans. The point being that if our plans are grounded and based in these principles, when they're implemented through our development, we will see the equitable outcomes in our built environment for people. The principles at a high level are statements themed to acknowledge history and repair past harms, practice inclusive and meaningful community engagement, commit to implementation with internal capacity and community transparency, advance economic opportunity and mobility, prevent displacement, expand affordable housing options and preserve existing affordability, support and strengthen diverse community values, promote people-centered multimodal mobility and connectivity, develop healthy and safe communities, and promote and regulate for environmental justice. There's more depth to each of these principles than I've captured in these titles alone. We have 19 staff participating in the 4-part mini-series, which began in February and runs through May, and they're doing a deep dive on how to operationalize these principles. And this includes staff not only in CPHD, but DES, DPR, and CMO across a multitude of disciplines and lines of business. Next slide, please. Under operationalize, we continue to apply the equity lens and share our analysis and reports and presentations. Most recently, as was acknowledged earlier today, you may have seen this in site plan reports as well as many of our housing reports that are coming forward to the board for action. Some tangible ways in which we consider the equity lens in projects, with a list of several such projects here as an example. And then when we talk about assess, it's our ongoing assessment where we evaluate our work, we take a deeper dive in our racial equity assessment and consider how to implement recommendations and continue to use data to assess what we're doing and how well we're doing it. Next slide, please. So on to budget highlights. Based on the board's priorities of equity, innovation, and resilience, housing, the proposed budget for CPHD would evaluate an equitable approach to development, center people, continue to place a high priority on housing and neighborhood and community programs and services to support those who are housed, create healthy, thriving, and connected neighborhoods across the county with an equity lens, ensure we have policies and regulations in place to process and review development opportunities with greater efficiency and better response, so being more proactive and less reactive. Continue to provide access and customer service experiences that are both high quality and timely, and ensure that we are good stewards of the development process with a focus on the long-term health and sustainability of the development fund. Next slide, please. In preparing the CPHD proposal, we therefore considered how to be strategic about the reductions proposed, attempting to minimize impacts to staff. There are a number of high priorities that involve CPHD, and we've looked to try to balance those priorities relative to the staff available to support the work needed and the levels of service expected by residents and our customers. We have tried to take into consideration the federal environment and how we can maintain the Community Development Fund at consistent levels with previous fiscal years. Also, we've considered the uncertain economic conditions and the effects on development projects, revenues generated, and fees charged for development services, while balancing the need to rebuild the development fund's fiscal health for the long term and maintaining customer service levels at metrics with staff time needed to continue to analyze those fees, collect and analyze additional data, and build the needed infrastructure to improve our fee processes, methods, and related policies. And with the resources available, how do we look at performance and metrics, what we produce, with a greater and intentional focus on outcomes or the impacts on people? Next slide. So our general fund, and you can go to the next slide. As proposed for CPHD in FY 2025, there would be a relatively slight increase in expenses and a decrease in revenues from FY 2024. The increase in expenses is due to the proposed addition of one-time funds for work associated with the historic resources inventory, while the decrease in revenue is based on our current assumptions around planning projects. For our planning projects, they are subject to market conditions, timing of developers, and circumstances sometimes beyond our control, and it is a fluid environment and subject to change. And in addition to what is being shown for revenues and expenses between what was adopted in FY 2024 and proposed for FY 25, there's a proposed change in staff from 82 full-time employees to 80 full-time employees. Next slide, please. A look at the proposed reductions. The 2 staff positions that are proposed for elimination include 2 associate planner positions in the planning division, 1 in comprehensive planning supporting long-range planning work, and 1 in current planning supporting site plan and use permit reviews. Both of these positions are currently vacant, pending budget considerations. In addition, a code enforcement position currently filled would be frozen in FY 26 upon it being vacated due to retirement. $71,000 in funding for housing consultants used primarily to support special studies and work associated with Housing Arlington is proposed to be eliminated. As has been done in the past, should the need arise, we anticipate consulting funds could be used through the manager's contingent. And last, $20,000 in printing costs. Next slide. And the next slide. So the Community Development Fund is resourced primarily with federal HUD funds and program income. We anticipate the entitlement funds for FY 2025 will remain unchanged from FY 2024. There's no anticipated change in the 4.5 full-time employee positions supported through this fund. Next slide, please. The Development Fund. For the Development Fund, we anticipate no change in staffing at 136 supported employees. We do anticipate an increase in both expenses and revenues as shown. With proposed changes to the fees that would accrue to the development fund, we anticipate an increase in revenue of $4.6 million. We are also showing an increase in expenses resulting from a new contract for elevator inspections. I mentioned in our budget highlights and considerations the long-term stability and health of the development fund and impacts based on economic market conditions and uncertainties. Part of the story, too, is the structure of the development fund, and that even with proposed fee adjustments, given what we anticipate with respect to permitting activity, we are showing a negative balance for the development fund. Fees generated through the work of inspection services have historically covered the difference between revenue generated through zoning work and operating expenses associated with zoning as well. With inspection services fees being the primary revenue source for the development fund used to cover market downturn, build reserve funds, and close the fund balance gap, with market conditions such as they are today, the balance is exacerbated. Now we'll discuss the development fee analysis and our proposed fees. Next slide, please. Oh, nope, sorry, you can go back. A little too soon. As shared during the presentation by the Department of Environmental Services, there was a multi-year review of the costs and fees associated with development and permitting. For CPHD, the review included 94 relevant fees to the general fund associated with planning reviews, 106 zoning fees, and 144 inspection services fees related to plan reviews and permits under the development fund. Next slide. The findings from the review show that the full cost accounting for staff time, overhead, and associated indirect costs is not being realized. And so what we are proposing is that over multiple years, we would increase relevant development fees up to 100% full cost recovery for both zoning and inspection services fees. This is important because the development fund is a self-sustaining enterprise that does not rely on net local tax support. The fees generated fully fund the operations of these divisions, and so they must recover 100% of the costs. For the planning reviews, the proposal is cost recovery at 75%. Cost recovery at 75% and not 100% accounts for 25% of staff time spent on work related to, but not specifically spent on the actual plan review and beyond the applicant's control, such as requests for the county board and planning commissioners and resident outreach and engagement. In addition, some fees are proposed to decrease, some to be eliminated, and others to remain unchanged as additional analysis is needed before doing so. We are also proposing a few new fees. Through the analysis and review, we have come to understand that more time is needed to better capture the time spent on reviews and associated data before we consider further fee changes. We will do this outside of the budget cycle. And given the complexity of tracking, documenting, and accounting for staff time on reviews, where there are multiple iterations, people, and interrelated processes, we look forward to being able to do so systematically or in a more comprehensive and complete way going forward. We will further refine and establish how best to collect data on staff time and recovery cost levels, but this will take multiple year effort. Also, we will have better data through reports in our Permit Arlington system moving forward, more detailed than the reports that we had from our legacy system, Permits Plus. Next slide. More detail on the proposed fee increases. For zoning services, fee adjustments are proposed to take place over the course of 3 years. Fees under 70% cost recovery today would increase 30% in FY 2025. Those fees between 71% and 100% cost recovery today would be adjusted to full cost recovery in FY 2025. We anticipate this will result in an increase in revenue in FY 2025 over FY 2024 of $212.5 thousand, generating revenue to the development fund of $2.62 million. Inspection services fee adjustments are proposed over 2 years. And for the 144 related fees, those under 25% will recover between 35% and 50%. Fees between 20% and 50% would recover up to 30% more, and those recovering currently more than 50%, but not at 100%, will recover an additional 25% more or to full cost recovery in FY 2025. We anticipate for FY 2025, $22.6 million in revenue will be generated as an increase over FY 2024 by $4.4 million. For those fees where additional analysis may be needed, as mentioned, there is no proposed fee change in 2025. Next slide, please. Planning fees are proposed to be adjusted to 75% recovery by no more than 30% each year until the 75% recovery is reached. We expect this to occur over multiple years beginning in FY 2025. For FY 2025, we also anticipate a revenue increase of greater than $85,000 from FY 2024, and for FY 2025, anticipated revenue from fees is anticipated at $1.56 million. Next slide, please. This example was shared by DES during their work session on Tuesday. It shows how the proposed fee increases would impact a residential project and a commercial project. I note that the fee structure and system is complex, as the development process includes many entities, reviews, staff, and inaction may not always be a linear process, depending on the project and development conditions. Also subject to economic and market conditions, as well as applicant submission, response and turnaround times as part of that review process, and permitting and review processes are interconnected across a number of departments and review types. It's complicated. However, the takeaway here is that all fees charged in FY 2024 versus FY 2025 with the proposed fee adjustments will result in a 25% increase in costs to residential projects and 19% for the commercial projects shown here. Next slide. So how are we performing? In the budget book, you will see our metrics related to each of our functional areas in terms of outputs. As an example of those outputs and how they translate to outcomes, we have looked at our housing development and supply, which is a priority area for the county as well as the region. I placed them here in this presentation because I want to make the connection between our resources, how they support our work, and what we produce, and the impacts, so sort of full circle. For CPHD, this was and is important as we reiterate our mission. The Arlington Housing Master Plan sets a goal of 17.7% of the total housing supply being affordable to households earning under 60% of the area median income. And this is achieved both with committed affordable units, our CAFs, and our naturally occurring or market rate units. This table shows for successive fiscal years, 2022 through 2024, the actuals and estimates for the number of CAFs approved and contribution to the cumulative amount in our supply. Then the total number of units that are affordable at below 60% of AMI and the number of homes provided to senior households and family-sized households. Lastly, for the same periods, we show how much money the county has allocated for housing units and how much has been dispersed. These numbers speak to production, or if looking at them against the Affordable Housing Master Plan goals, are performance metrics. Next slide, please. But what is the impact? How much did we do? How well did we do it? And is anyone better off? So it's not only what we have done or provided, but what is the result for the people? So far, what we can say is that 12% of our rental stock is affordable to households under 60% of AMI. 49% of rental homes are provided to families. 10% of rental homes are provided to senior households. 59% of accessible units are occupied by those who identify as disabled. Considering access to housing, this speaks to who is better off and by how much. Our family-sized rental homes consisting of 2 or more bedrooms provide stability for low and moderate income families as they integrate into their rental and county communities. Children attend schools, parents are employed, have transportation to travel to their jobs. Resident service coordinators on staff at our CAF properties provide integral links so that all family members are successful in accessing needed support to economically be successful socially as well. Our CAF rental homes that are dedicated to elderly households provide increased stability for low and moderate income seniors who are integrated into programs through their resident supports, which provide opportunities for socialization, health programming, food bank connections, and other wraparound services that support a resident to age in place and increase their quality of life. Persons with disabilities are prioritized for accessible CAF units, and with 59% of the accessible CAFs housing someone with a disability, this may provide for them to live with accommodations that enhance their quality of life and provide connections with service providers that will assist them to remain in stable housing in their units for as long as possible. As of FY 2023, 43% of households living in our CAF properties have lived there for 6 or more years. This longevity may demonstrate that households are content with their living situations and receiving the support needed to remain. As of FY 2023, 63% of households living in CAF properties have lived in Arlington for 10 or more years. This may demonstrate the strong ties that these households have to county and their communities. Next slide, please. And so when we consider outcomes related to our CAF units, if we start with the impact, what it is we want to achieve with respect to housing development and supply, the purpose is to ensure residents can live self-sufficiently with financial stability and well-maintained housing and supportive communities. In considering the performance metrics, outputs, and outcomes in this illustration of housing supply and development, we get to the application of the equity lens and understanding who benefits, who is burdened, who is missing, identifying the data we have and the data we need, and the strategies to employ to mitigate impacts in relation to our goals, plans, and policies. We will continue to review and collect data for additional outcome measures and understand where and how we are having an impact through the application of the equity lens. As we continue to further refine outcome measures and review and collect data, we will want to understand, for example, here, what has access to housing provided in terms of outcomes that improve quality of life for residents. We're excited to be able to further this work with the illustration provided here, but also to extend this to consider this across programs throughout CPHD and the lines of business in furtherance of meeting our mission. Next slide, please. Some upcoming and ongoing projects and activities. And speaking to programs, this slide represents collectively for CPHD the programs and projects being advanced based on the proposed budget for FY 2025. I won't read them all, but you will see the focus on housing, growth management, neighborhood and community investment, and what we understand of key countywide priorities. They focus on customer service, process improvements, and access to information and education. Things related to our neighborhood programs, housing developments such as Barcroft and Crystal Houses, our comprehensive plan update, multifamily reinvestment and home ownership studies, Permit Arlington and equitable engagement, historic preservation, zoning ordinance amendments and administration, and focusing on the development fund and fees. And I'm going to turn it over now to Anthony Fusarelli, Anthony, to speak more specifically about the planning-specific work program reflective of the proposed CPHD budget.
So I'm wondering if we should take a little break and see for questions, maybe not? Because I
only have
two more slides. All right, keep going, because I think this is where the discussion's going to be.
So thank you, Samia. Good evening. Anthony Fusarelli with the Planning Division, and on behalf of our entire team, very pleased to be here today to share a high-level summary of our division's preliminary work program for calendar years 24 and 25. By way of reference, I would note that a more detailed package of materials on this subject is posted with today's agenda. For the review we'll walk through now, I've effectively condensed 20 slides into 2. Next slide,
Well
please.
done.
Before highlighting our top priorities, I'd like to cover just the 6 key considerations informing this year's preliminary work program for our division. First is the ongoing need to timely address our non-discretionary services. And what I mean by this is really the work that is involved in site plan reviews, use permit reviews and amendments, also administrative change requests and other application-based work that ties back to the fees that Samia was just speaking to. Shifting to our discretionary yet also very important work, we're prioritizing in the year ahead the progression and completion of several long-range planning efforts that are carried over from last year's work program, really before adding any new initiatives. Third, with the continued interdepartmental focus on the Commercial Market Resiliency Initiative, we'll certainly be allocating time to address impactful regulatory, procedural, and policy updates. And also in the regulatory arena, we will be prioritizing specific zoning studies to address a number of known issues and also to better align our codes with our policies. A lot has been said already about racial equity, and so to be brief, we'll continue to build our team's capacity and capabilities in applying a racial equity lens through our work, including our approach to it, our engagement with it, and also the outcomes. Finally, with the potential reduction of 2 associate planner positions, we've attempted to calibrate this year's work program and its number of and timing of major projects with the potential need to complete this work with fewer resources and less capacity. And the last slide on the work program. So here we see our top planning division priorities for this year into next. To begin, we are currently looking at needing to advance the timely review of 10 active special exception site plans and use permit development applications, along with more applications we expect may be filed soon. We really have to complete this non-discretionary work in a timely fashion, and we do so with the engagement of the Planning Commission, their committees, and also the community at large. Next, our interdepartmental team is really excited to, at this point, be actively working with the J.R. Lynch ownership and community stakeholders to review the land use components of the Barcroft plan, which Ann Venezia had spoken to in her presentation. And so this work this year will really focus on what policy and plan updates are needed to help realize that ultimate vision, and then follow through with technical amendments to the form-based codes to help support that implementation. Also carrying over from last year's work program is the first phase of the comprehensive plan update. Through this work, the creation of an introductory chapter will address several aims, including modernizing the comprehensive plan's overall goals and objectives, more directly and broadly conveying emerging and cross-cutting challenges and priority areas across the plan overall, and more effectively centering people into the comprehensive plan itself. Our other long-range planning priority this year will be the multifamily reinvestment study, really which has its roots back in the 2017 work on the Housing Conservation District. This important effort really focuses on addressing key issues, opportunities, and challenges to renovations and redevelopment of multifamily apartment properties in many of our RA zoning districts. A lot of discussion earlier about MARCs, market rate affordable units. It's in these often aging apartment communities where many of these types of units or MARCs are found, and less affluent and more racially diverse populations reside today. Presenting both future challenges and opportunities. And so this study is vitally important in helping us envision a future where these properties can really deliver improved housing conditions and help get there through the creation of development policies, design guidelines that recognize the surrounding context and compatibility with it, as well as zoning ordinance updates pertaining to these districts. Briefly on special GLUP studies, our team's targeting Planning Commission and County Board review or consideration this spring on the Melwood special GLUP study, and we will continue to build upon recent refinements to our process and explore other ways in which the policy and how we approach this work can be refined moving forward. Progress on another key aspects noted in last year's work program involved targeted zoning studies. And so we don't have a specific list here. That information is available online. But again, really looking at addressing known issues that have emerged in recent months, but also looking at ways to update our regulations to support the implementation of our current policies and plans. And finally, the county manager's priority on commercial market resiliency, and so working closely with our partners within CPHD, Arlington Economic Development, and others to really effectuate change there as well. So with that, I will turn it back to Samia.
Thank you, Anthony. And I will just, next slide, please, just close us out with this slide, and then we can move on. So for us in this proposal, we are taking a balanced, equitable, and measured approach for our budget proposal that represents our work priorities and in response to the need to make reductions, fee adjustments, collect additional data to study and analyze impacts over time, and focus on not only outputs but outcomes. I also want to acknowledge that our organizational structure and how we support and encourage the work of our high-performing staff is important as well, so that we have the tools, the resources, and support needed to continue to do the work in times that are a little less amicable and a little more demanding. So this is CPHD. We create, we build, we make great places for people, and everyone plays a part, from the plan or the policy that gets developed to inform what gets built, to permitting and construction of the actual buildings and structures that ultimately get occupied by people. It's a continuum, and we are that continuum, and that is the Community Planning, Housing, and Development Division.
Thank you.
You are welcome to have a Lego which represents
Okay,
that.
thank you very much. Maybe in a little, we've got a couple of commissions to speak with it, and then we'll get into questions. So why don't we start with Omari Davis, Chair of the Historical Affairs and Landmark Review Board. Omari?
Yes, I'm here online. Can you hear me?
Yes, we can.
Okay, great. Fantastic. All right, good deal. All right, just want to begin by thanking everybody for the opportunity to speak today. And again, and also it's important, and again, I really want to take time to really thank everybody for time to speak today on these budgetary priorities. They're very, very important. Additionally, I'd like to thank you for your support for newly updated Historic and Cultural Resources Plan. I'm excited to work with you and HB staff on this bold new vision for preservation. Please note that full implementation of the plan will require additional county resources, both in terms of staffing and funding. And I guess please be cognizant of this while keeping other budgetary priorities in mind. And I'd next thank Manager Schwartz for the recommended inclusion of $100K in the draft FY25 budget to update the HRI, or Historical Resource Inventory. The HRI is a vital preservation tool. Thanks for this first investment and an overdue update that will make this tool more current and accessible, and also make development in the county more streamlined. Well, thank you for that. And on a funding note, I want to urge the restoration of the HEP's budget budget line item regarding the consultant budget. In recent budget cycles, this item has been slashed by approximately 87%. Without restoration of this item, HEP will continue to rely on one-time funding from the board to hire consultants for large projects, which will blunt the effectiveness of the newly updated plan. And finally, I'd like to say thank you to the board for support for a new historic preservation fund. HEP is currently administering projects for 12 grantees, and the community impact of those projects will help advance historic preservation efforts countywide, which is an awesome and really great thing. I'd like to really thank the board for that. And my hope is that these projects start rolling out in the spring, will inspire the board and sort of the public in general to definitely see historic preservation in work, and also inspire the board rather to pledge more support, more funding support in the future rounds of this great project. And I want to thank you for your time today.
Thank you. And thank you, Mr. Davis, and thank you. I'm glad you're pleased with that fund, and glad that you're helping us work with it. And that takes us next to our Sarah Steinberg, who's chair of the Planning Commission. Ms. Steinberger. We know you were there. Yes. Oh. We all want to keep seeing the baby. We may not listen as much to you, but we are delighted with the baby, who looks a little like not so sure about this. You're muted. You're muted. You're muted. Yeah.
Yep, sorry about that. I was saying Commissioner Weir is actually in the room, and he has my remarks, so I will let you hear from an in-person human, although no offense, Commissioner Weir, you may not be as cute as Albie.
Well, he's... No, he's not. Thank you. This is a
But
tough
I don't
act to
think
follow.
he's terribly offended by that statement. And I am very grateful to Commissioner Weir for being available to be in person for this as our childcare schedule changed a little bit with the adjusted schedule here. So
We're
I
all
will go back off
delighted that
camera
your
and mute,
schedule
but I will
changed.
remain available for questions. I'm
Thank
sorry,
you.
yes.
We're all delighted that your
Of course.
schedule changed and that we got to see the baby.
Well,
Thank you.
There you go. We're having pasta and avocado. It's a combination.
Are there any youth comments?
Thank you.
Oh, this is just
All right.
to tell us that, to remind us for whom
We
are
work,
actually
for whom we
working.
work, yes. All right, Mr. Weir, try to top that one.
I certainly concede that I am not as cute as Chair Steinberger's child, although that concession does not extend to my 18-month-old. We'll have to actually play
Bring them
that
in. Let's do
game
a
out.
contest. Let's bring them both in. Yeah.
So good afternoon, and thank you, Madam Chair, members of the County Board. I am pleased to be joining you on behalf of Chair Steinberger, who will stay online to handle any questions that y'all might have, but asked me to help her out during this particular time of the evening when young ones start going to sleep. So I'll be giving some feedback on the planning matters that we hope that the Commission hopes can be on your minds and agendas as you plan budgets for the next fiscal year. We hope that the feedback will eventually be reflected in the work plans of CPHD and perhaps other departments of the county. The following items speak to matters that CPHD and the Planning Commission have prioritized in our feedback for the fiscal year 2025 agenda. First, continuing the Commercial Market Resiliency Initiative to assist Arlington businesses post-pandemic and address our commercial vacancy rate. Offices and office culture look quite different post-pandemic, and we need to accommodate these adjustments as a county. Second, Barcroft Apartments redevelopment renovation plans. This includes the land use analysis presently ongoing and assessing the master financing and development plan for consistency with current policy. Areas of consideration include conservation area limits, transportation and parking, public space, natural areas, and urban design. This would include assessing where policy changes or mitigation efforts might be needed. Next is to comprehensive plan updates. The plan is our guiding document, and we need to keep assessing and reviewing the plan to make sure that it meets the needs of our evolving county. The next step to consider with our comp plan would include developing a new introductory chapter, introducing an organizational framework, and then implementing that framework and assessing the scope for updating the general land use plan to make those updates. 4, and there are only 7, and they're all short. Assess county policies and procedures that will encourage developers to invest in on-site affordable units in lieu of overwhelmingly selecting to make corresponding cash contributions towards the county's affordable housing fund. This review should include policies which apply to elder care facilities and how to identify and provide affordable units in these facilities as well. The next is the multifamily reinvestment study, continuing the work that, as Mr. Fisorelli noted, started within the 2017 assessment of housing conservation districts, including refining project scope, addressing key issues, impacting relevant zoning districts, and identifying and prioritizing new multifamily land use tools, such as design guidelines, affordable housing, policy guides, et cetera. Penultimately, priority GLUP and special GLUP studies, such as Plan Langston Boulevard for constrained sites and the Melwood Special GLUP study. And then finally, continuing to prioritize training and staff development opportunities for planning staff. This will be ever more essential as staffing levels for CPHD face a potential pending reduction, although I might note that the sense of the commissioners is that the many priorities facing CPHD do warrant filling these positions instead of eliminating them to more nimbly and quickly address these and other priority study and work goals. The Commission continues to be an active field for community engagement in the county, impacting multiple initiatives and projects. COVID impacted the way that we communicate and engage as a county, and we learned some valuable lessons for what successful engagement looks and feels like. We must continue to push for further engagement and make sure that our outreach to all Arlingtonians is meaningful and ultimately successful, no matter where in the county they reside or what kind of housing that they live in. The Commission, certainly Chair Steinberger and all of the members of the Commission look forward to being an active partner in that effort. Thank you for your time. And it says here, Sarah Steinberger, PC Chair, although I am happy to deliver and completely concur in the remarks that she asked me to prepare. I will be taking leave to go help get aforementioned 15, 16-month-old to bed. But like I said, Chair Steinberger will be remaining on the line.
Will you
as-
dial
as I
in so we
take note.
can weigh in on the competition?
You might get what you asked for. We'll see what
That
happens.
sounds great. Thank you. Thank you for pinch hitting. Really appreciate it. Okay, thank you. All right, colleagues. Questions with us. I would like to, I am guessing that we'll have a fair amount of discussion on the work plan, so I'd like to start with questions that have anything to do with anything but the work plan, if that's all right. And I'm going to start as chair, if I might, and I would just like to say, listening to everything and knowing the discussion we've got, I'm not very comfortable with the elimination of those 3 positions either. So I'll just sort of put that on the table. And thank you for a great presentation, really impressive, all of the strides you have made with the permitting and everything. And actually, part of my retirement plans involve a small renovation of the house. I'm going to check it out, and I will let you know how it goes. Thank you. All right, questions, colleagues? Who would like to go first? Why don't we take Maureen? She's at the end. She's got her light on. We're good.
Thanks. Okay. I didn't expect to go first, but on work plan, I think.
Well, we're going to do anything but work plan.
Oh, anything but work plan.
Yep, that's okay. I will move to Mr. Karantonis. Takas. That's okay. We're going to come to work plan. Don't worry.
That was quite an impressive presentation, Ms. Bird. Thank you so much for that. And it's your first in this function, so that was refreshing to see. I have one footnote, not really a criticism, not even a critique. CPHD is at a very important dial of what that touches climate resiliency and environmental resiliency. I didn't hear that in your presentation, and I think that this is important, very important to add it. The work of this department is really critical for our success in anything that has to do with environment and climate resiliency. Number 2, a practical thing, and feel free, if it's too long, it's very late now, Permit Arlington. It was impressive that you defended and you showed us how well the program is finally, September 23 is kind of complete, right? It's delivering, yet I hear continuous complaints about that. Not a few. And I'm happy to follow up in detail, but I just want to say that I do hear them, and this is kind of not, it's concerning to me. Like, I know how long everybody in this team has been trying to work on that, how much focus you have been on this, and it's kind of disheartening to hear still a lot of ongoing complaints. And I see already a reaction to that by doubling basically the FaceTime downstairs. But I want to hear your take on the complaints that you certainly are hearing as well.
So I actually am going to maybe ask Debbie or to be able to speak to what we're hearing, and I actually would love for you to tell us what you're hearing too.
I'm more happy to share that.
The system was completed in September of 2023, and it was a huge undertaking. We have moved everything online for the first time. I will say, when building permits went online in 2016, and by the time we started working on the new system, about 40% of people were sort of voluntarily submitting online. That increased to about 60%, and then the pandemic happened. And of course, everybody was forced online. I think that there's still a number of people who are sort of one-off, and not just building permits, but any types of permits. But there are a number of people who are only ever applying for a permit once. It's a one-time activity, and there is a little bit of a learning curve. It is a technology system. I will also say that we aimed high with the system. A lot of jurisdictions that say they do online permitting basically means they have an online application. We kind of shot for the moon, and that was predicated by having building permits and land disturbing activity permits and civil engineering plans online going back all the way to 2013. Having online plan review, has revolutionized what we can do with permitting, but it does make the system a lot more complicated than just being able to kind of submit online. But it allows the comments to be, the comments and the markups to be shared across different people. It allowed us to, when the pandemic happened, it allowed us to transition to 100% virtual within less than a week. So it's definitely not perfect. It's the kind of thing, you know, it's never going to be finished. There's always going to be things that people want and people need. There's always going to be a learning curve for the people who are either just less technologically inclined or just kind of only using the system once. Because we do online plan review, it's requiring people to upload plan sheets. That's a hurdle for some people. And I think we've worked to get a lot of instructions online. But it really does work for most people, and some of the statistics that Samia shared in terms of, you know, over 23,000 submittals with only 3,000 requests for tech support, and that includes, you know, kind of internal, like, oops, can you undo this? Not just this doesn't work, please help me make it work. So it's always going to be a work in progress, but it has revolutionized what we can do with permitting.
Yeah, no question about that. Our goal is to make it as prevalent as possible and have only that. I think this is a combination of procedures that people have been, you know, expecting to be more streamlined, you know, the first and the second, you know, to skip, for example, the first submission and go directly to the second because the issues, and so reduce that. I found out, of course, like in every industry, that people who use it more get more, you know, used to that. People who use it less, obviously, they're not, and so forth. So I think that, and it's maybe also a window into the universe of tasks that we still have to tackle. So I thank you for the work. I mean, I'm a very big believer in that. I'm just saying that I still hear some complaints, and you know, when economic times become a little bit tougher, people tend to be more attentive to these things, right? Thank you, and especially when we are increasing fees, so they will be asking.
It's nice to see Ms. Alpert again. In my experience, all you take on are really big, huge, complicated projects, and you disappear for years, and then you come back, and it's done. It's nice to see you again. I can't wait to hear what you do next.
The zoning ordinance reform, I think.
Maybe. All right. Ms. Cunningham, Susan, go ahead.
Okay. Actually, before we leave Permit Arlington, if you don't mind, it was, being a newcomer is a little bit hard to tell, but was that project, did we come in on budget, and like, did it go as we planned, even with the pandemic in the middle? Anything you want to share about that?
I guess there's a long answer to that. It was initially envisioned as a 15-month project. Mm-hmm. It was probably a 7-year project. So it was expanded substantially, but I will say that there was a restart about 8 months into that 15-month project, and one of the reasons for that restart is because we had bought what we call a COTS, custom off-the-shelf product, and the plan review function with that was basically Adobe Acrobat. Mm-hmm. Our customers had gotten used to. We use a product called OnBase ePlan, and they had gotten used to that over the 2013 to 2016 when we had building and LDA and CEP permits online. That was just the level of review that people were expecting and that worked for this county. So when we integrated that, it became a very different project, and there were additional costs.
Got it.
That's the short answer.
Yeah, that's great. We'll take short answers tonight. Could I have more than one question, or you want to do rounds?
Go for it. Okay. No, we'll just keep moving.
On the fees, so I'm glad to see us living through the fee study. I know it was not easy. I'm curious, A, are we building in inflation adjustment going forward so that we'll stay somewhere near reality? And B, have we done comparison to other jurisdictions, and how does that feel?
I do think, yes, the inflationary, it will be part of what we'll be including. In comparison to other jurisdictions, I think we found that there was not much comparison to be had. We were not able to make many comparisons to other jurisdictions, at least from the fee review, the information that we received.
So for the example projects, for instance, we can't see what they would be in another place without building them.
Not necessarily. Not. I don't know that it's a apples to apples comparison.
Gotcha. Okay. And then I have a lot of other questions on expanded housing. I don't know if you want me to go there now or give everyone else a chance. We'll come
Okay,
back.
and can some of them be sent in
And
later?
if I can mention one thing, on Tuesday at the recess meeting, I'll be coming with the
Correct.
update on EHO
Okay,
permits.
so
So
we
we can talk about, well,
Till
yeah.
then, that is great.
Okay, good. Matt, Mr. DeFranti.
Thank you, Madam Chair. So I jumped the gun on the code enforcement question. So can you help tell me, or I was premature on asking that question. So what is the code? First, I really appreciate that we are trying to the extent possible in the budget as a whole, those who are retiring or vacant positions are where we have focused on the limited number of reductions. And so I wondered if you could kind of help me understand what that role does and how that fits with our housing discussion.
So it's not one of our housing inspectors. It's
Sure.
in our inspection services division, code enforcement. The other thing, and I may ask Ashara to explain a little bit more, but the other thing I did want to point out that that position is not expected to be frozen until FY 2026.
Got it.
So we're showing it now because it is filled. There's an incumbent in the position that we may retire.
Yeah.
So it will be frozen in FY 2026.
Thanks for that clarification. Maybe Sharia, or you could help me a little bit with what the code enforcement and ISD, there's an interplay there, and so. if you share-
Actually, there's not too much interplay. What the housing inspector do from a lending perspective, and can answer that better, the different vouchers.
Sure.
What we do in code enforcement is make sure the buildings are maintained in accordance with the building code under which they were done. So, for example, we deal with, lean and clean, that entire thing that we deal with noise ordinance, and we deal with Virginia Maintenance Code. That's the responsibility. So it's not, ours is mostly, 50% is complaint driven.
Mm-hmm.
We can't just walk an apartment building and enter.
Yeah.
We cannot do that unless there is a complaint on that one. So it's never an easy choice.
Sure.
But the things will take longer, and we can't do as many proactive because of that frozen position.
Great. I guess for me, the 2026 piece of it kind of helps me align with where the chair mentioned. And then the questions, these are about the other two positions and trying to understand. I think it's, a bridge question with, we said we'd hold on work plan, but can you help me understand, there's the current planning and comprehensive planning, and can you help me understand the work that those would do and/or what, without getting in the wrong lane, what could be done if we restored those positions, or what would be done under the current proposed
I think
approach?
Mr. Frucarelli's going to speak to that.
I appreciate the question. So the associate planner position on the current planning team, their workload typically would focus on use permit reviews and applications that come before the county board on a monthly basis. They may take on, they may be bringing forward and reviewing some of minor site plan applications that also land on the board agenda, but and then also supporting a lot of the other, I think, procedural and administrative improvements and refinements that we are working to make on an ongoing basis within the planning division. So really focused on applications coming in. And then on the comprehensive planning side, that associate planner position would really work mostly in a supportive fashion. And it could be on a variety of projects. It could be providing support on an area plan or sector plan, as with like Langston Boulevard, by example, being a contributor to a larger team.
Yeah.
They could also be working on amendments to the general land use plan, or providing support work on zoning ordinance amendments. So as an example. So, but the associate planner role within that section, in a large part is not leading
some of those major initiatives or projects, but providing very important support to principal planners and others who are might be leading those initiatives.
Great. I'm mindful of time, and so the see if I got the recollection right. Last year, this time, there was one vacancy which we had yet to fill, but we've filled that vacancy, and then life happens, and so we've lost one or two people. Is that right? I just want to think about, there's no doubt I'm for one of these positions. I'm probably for both, but I want to understand enough about vacancies, and I want to live in a resource-constrained environment rather than say, I'm for everything all the time.
No, appreciate that question as well. Actually, when we were sitting around this table but roughly a year ago, I think we were actually managing 4 vacancies. We were actively recruiting 3 of them. There was a 4th associate planner position that became vacant due to a retirement, and that was included as a reduction as part of the fiscal 24 budget. So we had lost, that we were reduced by 1 associate planner in last year's budget. To provide, if that provides the context you're looking for.
Great, that's helpful enough for me. I think it might be helpful just to follow up offline to understand retention rates. My perception is that retention rates are pretty high, but I'm also mindful that perception at this stage of my life is not always reality, and so I think that's. But basically, that gives you, I hope, a little context as to where I am. Thanks.
Thank you. I think we're ready to move on to the work plan. And I will start with Maureen. You ready now?
Yeah. Thank you. And I think Matt's questions were, in fact, a really good bridge. And I would align myself that I don't feel great about cutting planning roles. I think we have a lot of work we want to do, a lot of things we want to see, and we're going to need to plan our way to get there. And I worry about not having the capacity, and I think I would like to spend a little time talking about the comp plan review and kind of what we hope to see come out of that and how that can potentially also help future planning efforts be a little bit easier going forward, if you don't mind.
Yeah, absolutely. And for assistance with that, I'm be asking Jennifer Smith, who's our comprehensive planning manager, to fill in any gaps that I might not address. But as I mentioned earlier, this is a carryover item from last year's work program. We were successful in early last year in getting the Planning Commission to really approve and accept the 5-year look back, the retrospective of updates to the comprehensive plan, but are extremely excited about this look ahead. And so that phase 1 work, as it's currently being scoped and envisioned, is really focused on establishing an introductory element to the comprehensive plan. We've recognized that as a sort of a missing link that could better tie together the 12 individual elements of the comprehensive plan now with the Forestry and Natural Resources Plan, especially in the way that it can address a lot of the present day and recently emerging issues and priorities, whether it's racial equity, whether it's commercial resiliency, climate, digital equity, a whole public health. There are a number of really important components of this community that aren't necessarily perhaps as spotlighted in the comp plan as it should be. And so that's a big part of it. But if Jen is joining us now, she can, I think, speak to perhaps a few more of the details.
Yeah. Good evening. Thanks for the question. Yeah, we are very excited about this opportunity. Take a closer look at the comprehensive plan from an overarching perspective. It's been quite some time since we've looked at our growth goals. There certainly are many facets that in modern day planning that we are just not really syncing up with, and trying to have an opportunity to better communicate what some of our values are and how some of those cross-cutting issues really thread through the comp plan and multiple elements, so that they don't come across as individualized elements and really how they piece together. So we're really excited about this work, and we're in early stages of scoping and talking to our interdepartmental team members about that and how they can see themselves in this work and the importance of this work. I think that introduction section is also going to be really important for us to be able to better communicate with our community members around just what is the comprehensive plan and what does it mean for all of us, living or working, visiting in the community. Another piece that we have mentioned as well through some of our internal conversations is, again, just how the elements are important in conveying in 12 different elements, key policies of our community. There will be times where we need to perhaps look at how we can achieve all of those elements. And certainly we strive for achievement of policies across the board, but there are times where we may need to make some choices around what we can achieve. So I think that's a part of the introduction section and how we can inform the community, ourselves, different stakeholders, property owners, developers, how maybe we go about doing that. Not that we will necessarily set prioritization clearly, but we can provide some additional guidance and clarity that is something that's needed on a project-by-project basis.
Yeah, thank you. I think, we hear all of this, it's a lot of work, and that's what guides my feeling that especially the planning role in the comprehensive planning division is not something that would be good to just get rid of.
Thank you. Takas.
I have to preface that I also believe that we have to retain the positions. I agree with Mr. DeFerranti that it's we need to know exactly what they will be doing and where we will be using these human resources. But even if we go by the prioritization that Mr. Ware offered, like CMRI, which we are in a hurry to get done in 2024, actually. Barcroft, comprehensive plan, multifamily residential study, etc. The special gloves. So I find that there's enough justification for these. We have another emerging issue that we have had it for quite a while, and we haven't addressed that seriously as of recently, which is the low residential lot coverage discussion, which came back through the, you mentioned the natural resources master plan update. So there was talk about looking into this for environmental reasons, for a ton of reasons. Now, I understand that this is really a very multi-dimensional issue, and it's not an easy approach. It's also not, in my category, it's not a very high priority, more than the aforementioned, but it's a high priority nevertheless. So it's a persistent priority, I should say. So can you tell us how you feel about that? Where can it find a place in the work plan?
Yeah,
to get started?
No, absolutely. Appreciate the question. And reflecting back, I think, again, on this same conversation we were having 12 months ago, at that point, I think our priority in terms of the work plan itself was bringing to conclusion a number of major planning and policy updates. Now, looking back over the past 12 months, EHOs and completing the missing middle housing study, completing the food study as another and both of those very important interdepartmental efforts, and then in November, bringing forward Langston Boulevard area plan. So looking back at some, I think, key accomplishments that we had suggested last year, let us get through those, and then also through these carryover items, such as the multifamily reinvestment study, such as the comprehensive plan update. Barcroft, the MFDP is finally sort of gotten ready for us to kind of play a role in that as well. And then I think at that point it was, once we can complete those, looking at the low residential neighborhoods again in the context of single detached and EHOs would I think be really fitting timing, in addition to not just the comprehensive plan update, but also the Arlington 2050 initiative that's happening this year, both of those being opportunities to kind of think about the future vision and being able to leverage what might come out of those conversations and pull it into a low residential study.
Thank you. I'm really interested to begin to frame the scope, like understanding what the desirable scope is for get started. The Natural Resources Master Plan update gave us already a pre-framing for that. So I will reach out to you again and offline to figure out what the appropriate and reasonable scoping, given the priorities that we have, that you have on your current work plan, and take it from there. I think that we would be serving well our community if we began to be operational in that and intentional and say, look, we need to look at this. Let's study that first. Let's gather some data. I was extremely impressed when the HO, the preliminary study to the HOs started with a compendium, right? So it took a while. It takes work. But it's a good base to have a common understanding of whatever issues and challenges there are. Thank you.
Matt. Thank you, Madam Chair. First question is, there are standalone reasons to do the introductory chapter of the comprehensive plan update, and then there's that are linked, I think you could arguably say, with the visioning that the chair started. Is it also, it's also required every 5 years by state code, I feel like. And so help clarify for me, or something is required. And my reading of state code is that, or my impression, not reading of state code, is just that it's not you might not have to do it robustly in order to satisfy the code. You would have to support it. But what you're describing is doing more, and it's almost not entirely an elective choice to do more, but is that, am I understanding correctly on that?
Yeah, I would say briefly, I think that's a fair characterization. And I may have mentioned that I think it was early in 2023, we brought to the Planning Commission sort of our 5-year review, which really met, from our perspective and consult with the attorney's office, met sort of the legal standard per the Code of Virginia to really look back at what changes had been made, and then looking ahead at identifying areas that we think would be appropriate or advisable to update the plan. So that the code language, I think, provides some bracketing there. This, I think, as you said, is really something that we would view as doing above and beyond what the Commonwealth requires, and for the reasons that we had stated.
Great. Well, then I think it would help me to understand a little bit better, and via 2x2, and then perhaps over time another conversation, so we really integrated the thinking about how we're going to work Vision 2050 and this together, and do so in a thoughtful way. We don't have to know precisely what it's going to look like, but I feel like if we don't have some architecture of how we're going to have this conversation, I would want to understand it so I'm better aligned with what you're doing. The other two, just mindful and being quick. For me, Community Land Trust, last year we had a wonderful board member who did not support community land trusts. He is no longer on the board. And now there are people who have replaced who do support community land trusts. I mean, he would have said it more elegantly, for sure. But there are three, I believe, there are at least 3 of us who support community land trusts. There may be 4. And so I want to say that out loud, because shared equity home ownership, we have, it's important. And I don't know that I'm asking for a response at this moment, but I just felt like I should say that out loud, because, I'll follow up, but that's a thought. And then on low residential development, that may be a shorter term question. I can follow up on this too. I'm wondering if one-time consultancy study fees might be an avenue to work on this. There are risks. It takes time to manage a consultant. And, you know, I'll just fess up. The look of a neighborhood is not my greatest strength. I mow my lawn. I like architecture. But the look of a neighborhood, that's important to me. And it's super important to some people who are in Arlington. But equity and, you know, homelessness, there are other things that are more important. There are 3 goals of that low residential piece. And so I'm interested in not outsourcing, but also seeing if there's one-time resources that might be possible. And I don't know if you have any off-the-top thoughts on that, or you just want to, I can also follow up.
Yeah, I mean, I think we could take that back and give it further consideration. I think actually, again, last year there was some conversation as it scoping for a potential low residential study, you know, how might consultant resources assist with that? And I'd never sort of discount or preclude outright that opportunity, but I do think that through a lot of the work ongoing with our partners in environmental services and parks and recreation, there's a lot of institutional knowledge and intel, you know, within the staff enterprise that absolutely, you know, I'm sure there's ways that could be supported and bolstered with consultants.
Yep.
So I think that's something for us to maybe take back and think through, like how, you know, different scenarios or ways in which we could approach that.
I think there's a ton of legal issues in this. I want to say that, just say it. And I also think that it's a the one-time thought is a means to help get started, where I do, like, you know, I will say out loud, there are other things that are higher priorities for me. And maybe that's not perfect politics, but that's just a fact for me.
Thank you. Susan.
Okay, couple work plan questions. So one is, I read in the materials, and again, coming up to speed here, but that last year's work plan was not completed, and so many things are rolling forward into this year. Can you say a little bit more about kind of what got in the way of that? Was it the vacancies or something else in terms of surprises along the way?
Yeah, I mean, I think there's layers of reasonings or factors that go into that. And I'd say probably on a year-over-year basis, our annual work program, I would say, is consistently an ambitious one. That being said, I mean, particularly looking at last year's, the scale and scope of accomplishments that I think we were able to realize, I'm proud of, and I know the team is quite proud of as well. But I think some of the elements that could lead to perhaps not as accomplishing as much as we want, certainly those vacant positions, right? We were dealing with several vacancies and the recruitments associated with filling those positions. And so that's, you know, staff hours that aren't working on some of these elements or projects in our work program. Community engagement, right, is also, it's really important to us, and it's really important to the work we do. But it is often additional time, despite the great resources and support we have from our in-house communications and engagement team, doesn't always go as planned, and sometimes you get great input through that engagement, but it entails more work and entails more follow-through. And so I think, you know, those are certainly a couple of the variables that I think we're grappling with on a yearly basis. And then on the development review side, we're seeing, you know, based on the market and the conditions out there, that there's a good deal of unpredictability in terms of the pace at which certain applicants may be advancing their applications. And so they may file a site plan application, they'll start the review, but something may arise and there's a hold on it. And then that sort of, you know, stretches out the duration of that review as well. So those are just a few examples that I think, you know, yield some of this work carrying over from one into the next.
Great, thank you, and I appreciate that reflection. And Ms. Bird said something earlier that caught my attention, which is we're sort of in a time that is less amicable. Could you say a little bit more about how that is influencing sort of the capacity and the work plan, thoughts on community engagement, and how we might reset with efficiency and staying true to our values on community engagement.
I think some of that is just the natural environment that we're in right now, just in general.
Yeah.
Right? We've all come through a very trying several years. There are a lot of competing priorities, a lot of different interests and issues that people want to be addressed more immediately. And I think sometimes that is reflected in the response that is received. I think where it's most impactful, maybe is a little bit with the staff morale, if I'm honest, and how that impacts people's ability to be able to function and continue to do the jobs that we have consistently done at a high level. So I think about a lot, some of the, Ms. Garvey and civility, I think some of that, it does impact in staff and the work that we do, I think. We continue to operate at really high professional levels, and we still continue to try to, meet and exceed the demands, but I think that's where we see the impact there. I'm not sure what efficiencies might help, because I do think we are committed to what we've seen with more inclusive engagement. Maybe it's the way we engage, or looking at different opportunities for that. But I'm not sure where necessarily there will be efficiencies, because like Mr. Fusirali said, that, when we do that, we are, increasing the work in the same way. But for a good yield, I think, if we can get a better outcome.
Great. And then I would just wrap up. I think you've heard from at least four of my colleagues that we are enthusiastic about getting you fully staffed and having folks back. So I will just reiterate that as well, and ask Madam Chair that we consider, I think it is useful both for us and for the community that we have a transparent conversation about the details of the work plan for CPHD. And I wonder if we might be able to schedule that a little later in the budget process, maybe the week of the 9th or so.
Thank you. We'll see. It might even go after the budget process. We'll see. I'm thinking, but we can talk about that. And I'll even actually continue on why. The Community Land Trust, interesting. Thank you. I've heard about it. Interesting. This board member isn't necessarily in favor or against. I just don't know much about it, so I'll be interested in learning about that. And I want to talk, which I think that this low residential lot coverage, I think we absolutely have to do it. I think part of the upset that we're hearing in our community is somewhat from that. When we got into the EHO, missing middle, people were really upset. They talked about lot coverage, because I was told by staff, when we get done with that, then we're going to look at lot coverage. And then we got done with EHO, and we're not looking at lot coverage. And then we get the natural resources plan, master plan came forward, and I got told by staff, once we get that, they're going to recommend this, and then we can move forward. And we've gotten them the plan, and it said we should do this, and we're still not moving forward. So I feel like there's a reason people might be upset with us. And I think every time, I could go up in tours every 6 months or a year, come and see this house. There were these beautiful trees, and it's gone. And it's kind of, it's upsetting to folks, and they think it's lot coverage is the issue. And I think often it might be. I know it's incredibly complex. I'm well aware, and I think maybe the most recent time I talked with you about it, Samia, was, and you said, well, we're asking us to do more work. You got to give us more staff. So those 2 people you're cutting, I want to put them back in, and I'd like them to be for this, or at least one of them possibly. Possibly we do it with a consultant. I'm not going to tell you how to do it. And I don't know that I have 3 other votes here. I think I might. But I feel really strongly we've got to start it somehow. Maybe it's really just a good scoping. Maybe it's a phase 0 where we do, some studies. Like we did with the missing middle. I actually thought those foundational studies that we did at phase 0 was really helpful. And particularly in this issue, because people come to us interested in it. They're upset about trees, and they're totally focused on trees. If you just stop this, the trees will be saved. But they're not thinking about other things like the height and the shading and the stormwater and their legal issues. And I think there are more issues that I don't even know about. But, and somebody else will come up with something else, and they're not thinking about the trees, they're thinking about. So there's a lot to think about and unpack. This is a very thoughtful community. I think some real sort of academic studies. Maybe the consultants is actually, one of our. But this board member, and we'll work this through in the budget, I really, really want to have that included in our CPHD plan, and I'm willing to put in the resources to do it and figure out a way to do it. And even if it's only starting with phase 0 and kind of scoping, I do think we owe it to our community, and I think we need to get going on it. So that's what I have on that. Anything else for the good of the order this evening? Thank you. Really impressive. I think this board, I won't be here, but I think next time we're going to split up these two groups or somehow a lot more time. I keep texting my grandson. I'm going to come. I promised him pizza. I think he's getting really hungry. I need to go home and get my grandson some pizza. So thank you so much. I know you all need to get home too. So thank you. Really appreciate it. We're going to be back here. Next work session is next Thursday in a week, but between that, we're going to have our Saturday and Tuesday board meetings. So come here just about any time. We're going to be here. Thank you. We're assessed.